extra copies. Should I?
Wonderful. Thank you.
Do you want to, or put them up there?
I can.
Or? Okay, thank you.
Absolutely.
Thanksgiving.
It's nice and low key. I like Gratitude Day.
Yes. We could all use more of it.
Exactly.
And more things to be grateful for.
So true. So true. How was yours? Is it okay?
Oh, it was good, yeah. We took my in-laws to New Jersey. Extended family there. My sister came down.
Nice. How was the food? Food good?
Yeah, I made the pie course.
It's my favorite part.
Made major pies.
Nice.
Oh, you made.
You want to pose for a holiday photo? Sneak one in. Thank you. Saves us the scheduling.
You brought copies or did you want? I brought some copies.
I brought copies of mine and I gave them to, I can't remember her name.
So she,
The woman in the middle there.
ready?
And she
Good afternoon, or good evening. Well, we're just about there. Thank you for coming to the City Council's Childhood Poverty Hearings. I am Lachey Harris, Vice President, City Council, and the Chair of People, Parks, and Public Works Committee. I am very, very proud to be leading this effort and want to thank my colleagues for joining me here today. I'm also extremely grateful to all the experts who will be providing expert testimony before us today. I've invited you here to get your perspective on childhood poverty in the city and to hear how it affects the families that you help every day within your organizations. This forum will be aired on WXXI and City 12 tonight and streamed from the City Council's YouTube page. We all know that childhood poverty has enduring implications for the children within the city of Rochester. Poverty presents serious barriers to our kids' lifelong health, well-being, and development. The ongoing toxic stress of poverty through housing instability, food insecurity, inaccessible health care, inadequate child care, and unsafe neighborhoods, and lack of educational opportunities all lead to long-lasting impacts on children and families. As Vice President of City Council, I am committed to creating a Rochester of safe neighborhoods, quality housing, and equitable access to opportunities. That is why I have launched our Children Poverty Initiative. Today's hearing is a part of a larger effort by our committee to gain a deeper understanding of the causes and impacts of childhood poverty, because we need to protect the future of our city by protecting our kids. It's time for policies and interventions that actually work, not just at the city level, but also at the county, state, and federal levels too. Together, and I mean together, we can work to make sure every child in the city has the best possible start in life. You are here today because it's critical that City Council hear from you, your organizations, who have direct contact with this issue on a daily basis. As we engage in policy and decision-making around poverty, I feel it is important to get your viewpoints and ideas on what you've seen, what your organization does to contribute to a better quality of life for our kids, and any possible solutions that you think will contribute to improving or eliminating childhood poverty. You are the experts, and today the floor is yours in terms of the process and how our time together will unfold. Here it is. I will call each organization to come to the front table to present to the committee. You will have 10 minutes, which includes questions from the committee. To my colleagues, and actually we're joined here by our esteemed President Miguel Melendez Jr., and I have additional colleagues that will be joining us later. They're on their way. We will ask them to provide in writing through the council staff, who will follow up our presenters after their testimony. To our presenters, if you have any handouts or written testimony to provide council members, I ask that you please give them to our staff. The copies of the agenda are available on the back of the chambers, on the desk in the back of the chambers, with a highlight of the order of each speaker. Does anyone have any questions before we begin? Okay. Great. Thank you for attending today's forum. Actually, we are joined now by Councilmember Stanley Martin. Thank you for coming. And up first, I welcome Larry Marks, Chief Executive Officer, and Eamon Scallon, Director of Community Impact, both from the Children's Agenda, who have been our staunch supporter and partner in this effort. Thank you, Mr. Marks and Mr. Scallon. You go ahead and start presenting.
Well, thank you. The Children's Agenda is grateful to Vice President Harris, President Melendez, to this committee, and to the Rochester City Council generally for focusing on solutions to child poverty in our community. We're grateful to be your partner in organizing these hearings, surveying families, and aiming to do our utmost together. Make no mistake, poverty is a policy choice. With different programs and services, while different programs and services can help groups of families to beat the odds, policies are the only way to change those odds for all. It's a difference between softening the blows of poverty versus structural changes that eliminate poverty. A couple of quick data points to prove that. In 1967, 30% of all senior citizens in the U.S. were struggling to survive in poverty. By 2021, after increasing the average Social Security expenditure each year a little over $4,000 to over $9,000 in 2021, the percentage of elderly citizens in the United States in poverty fell to 10.3%. Before the creation of Social Security in 1935, it was over 50%. The percentage of children living in poverty was 13.7% nationally in 2018. But after the expansion of the federal child tax credit during the pandemic, poverty was cut in half nationwide by that one policy alone, down to 5.2% in 2020. That kept an estimated 9.6 million children out of poverty, fewer evictions from homes, fewer neglected asthma inhalers and other medicines, fewer missed meals. Once that ended, 3.7 million children nationwide were plunged back into poverty. That included 224,000 children in the state of New York and 10,000 in the city of Rochester alone, just over that 1 year's time. The Children's Agenda recognizes that children don't exist as some sort of atomic unit by themselves. All children grow up in families, whether of origin or not, and all families are inseparable from the communities they live in. Every community is shaped by the power relations and the underlying policy decisions that touch every child's health, education, and well-being further upstream. So in addition to what my colleague here is going to talk about at the local level, I want to focus on some state solutions. We do have some wind in our sails at the state. The Child Poverty Reduction Act passed in 2021 thanks to the chief sponsorship of Assemblymember Harry Bronson and the support of our entire state local legislative delegation, codifies an official goal to cut child poverty in half by the year 2031 in New York State, the only state to have made that official goal. The single best evidenced way to meet that goal is to supplement family income. Rather than prescribing solutions, like we think you ought to take this class or get that educational certificate or whatever it may be, additional cash is the most efficient and best way to ensure that people can meet their own needs, whether it's putting more and better food on the table, getting that used car or bus pass to get to their job, help affording the apartment closer to the new child's new school, etc. So there are 6 currently pending approaches at the state level that would be part of the best answer. One is expanded tax credits. The Working Families Tax Credit would combine the current state portion of the Earned Income Tax Credit and the Empire State Child Credit for a brand new benefit, lifting hundreds of thousands of our poorest children out of poverty like that. Short of that, there are all kinds of other ways to improve state tax credits. There is the Mothers and Infants for Lasting Change bill, sponsored by Assemblymember Clark, as well as Senator Ramos, providing direct cash supports to mothers and their newborns up to $15,000 every year up to age 2, based on the successful Bridge project here and elsewhere around the state. Medicaid Healthy Birth Grant provides 47% of all birthing people and their newborns $1,800 at birth every year and brings in half of the cost through federal dollars. Child care workforce supports. New York State spent $800 million in 2024 in this budget cycle to supplement child care workforce compensation, but it was one-time only temporary support. There's a growing shortage of child care availability for families who needed to work as a result of child care workers leaving the profession in droves. The average wage of child care workers in New York State is $13.55 an hour. It is the 97th lowest percentile paid profession in New York State. Most child care workers themselves rely on social benefits. Then I'll also just mention public benefits, the New York Housing Access Voucher Program, and reducing administrative barriers to access existing social safety nets. I'm realizing I'm running out of time for sharing with my colleague Eamon. I just want to express we look forward to partnering with City Council on both local as well as state solutions. We can advocate and win the changes our children and families need together.
Thank you. And I'll just move a little bit to a focus more locally, and I think Larry did a great job summing up some of our state initiatives. So, according to a report released by the New York State Comptroller's Office in May 2024, Rochester has the 5th highest poverty rate among large cities in the U.S. at 41.7%. And that number has fluctuated throughout the years. It's been as high as close to 50% in past years. This is more than twice the rate of Monroe County as a whole, which, according to that same report, sat at 19%. And if we look at our city's public schools at RCSD, there are 90% of children living in an economically disadvantaged household. There are many studies showing children living in poverty fare worse on average compared to wealthy children on a wide range of metrics, including mental and physical health, academic achievement, labor market success, and involvement with the criminal justice system. This is correlation, not causation, and there are exceptions to the rule, but on average, it is clear that family resources are the best predictor of childhood development and future success. This would suggest that getting resources into the hands of families is among the best strategies to combat the many challenges children are facing in our community. Currently, the city is developing a children's savings account program, which would provide a small savings account to every child in the city of Rochester, with ways to earn additional bonuses based on family need or participation in certain activities or programs. We are very supportive of this initiative as we believe it will increase child participation and persistence in post-secondary attainment, which research has shown consistently. So we applaud these efforts, and we'd like to reiterate our recommendation that the program start at birth rather than kindergarten. We know there are some difficulties with coordinating that with the county and state, but that is the most efficient use of those dollars, as they will accrue interest over a longer period of time, and the psychological and other benefits to parents start from birth. The city also has a unique opportunity to alleviate child poverty with the $25 million in temporary assistance to needy families, or TANF funding, that will be administered by Monroe County in consultation with the mayor. Unfortunately, this comes with strings attached. It only is applied to certain zip codes and is time limited. But we are very supportive of one initiative that was turned down by the state, but we still think is a really important project, which is modeled on the Bridge project, which is direct cash transfers to pregnant women. And we'd like to see that the city and county still partner to broaden and create a program like the Bridge project that is broad-based and touches all children within the city of Rochester. And my time is running down horribly, but I will just mention a few other things that at the county level we are currently pursuing, and we'd love to partner with you on. One right now for the county is considering its budget, and we'd like them to adopt a 2-year eligibility for child care assistance. This would reduce paperwork burdens for parents and ensure fewer gaps in benefits. We'd also like them to increase the Department of Human Services staffing for convenient and timely access to benefits, from food to housing to child care assistance. And finally, we would like them to take your lead and have a child savings account program for the whole county. So no matter where you live throughout, you will have access to that program. Again, thank you for having us, and if you have any questions, we turn over to you.
Thank you, Mr. Marks and Mr. Scallion. Is there any questions from my colleagues here? President Melendez.
Yes, thank you so much for sharing the information. I'm familiar with much of the advocacy that Children's Agenda is currently doing and undertaking. And my initial question is just around what more can City Council do? So we heard some of the initiatives that are in our purview at the end here that we might be able to take some direct control over and push. But in terms of the advocacy at the state level, obviously we're not state legislators, but what more do you perceive that council could be doing to advocate for the citizens of Rochester?
I think it's really important that everybody back the same key pieces of legislation and advocate for it. So my understanding is the city has its own intergovernmental relations department. They should be on the same page. I think City Council has talked about having its own advocacy efforts. That should be on the exact same page as over 120 organizations that are part of the End Child Poverty in New York State Now coalition that are backing the expanded tax credits and all the other legislation. So we need power to win, and it takes numbers, and it takes the influence of City Council and the City of Rochester.
Thank you. And in terms of, I'll probably have some more follow-ups in writing, just given the time, but I appreciate the content that you shared with us. I do think that one thing I would offer for consideration is engaging the Vice President and I and other members of Council on the fact that we can introduce memorializing resolutions from this body to other bodies of government, and I think that's one way that the council could beef up its advocacy in support of initiatives that are impacting young children in our community. So I do offer that for consideration, but I yield the floor.
Thank you. President Melendez, any other questions? Councilmember Martin.
So at the state level, the milk bill has been introduced, and there's a lot of support from community organizations and people on the ground. How would that interact with a local program funded by council or the county per se that also would be interested in giving direct payments to mothers?
Yeah, I think it supplants money that would then go elsewhere, meaning that if the city were to self-fund a very similar program, perhaps for many more families that would need it within the city boundaries, then the state bill would do it. They're only talking about 15,000 births per year. There's something like 8,000 births per year, I know, in Monroe County. I forget how many in the city. But that would only cover a fraction, the state legislation, the milk bill, of what the city could do on its own. And that is one of the single most powerful things that could happen. Birthing itself plunges many people into poverty. It takes largely women out of the workforce and sometimes halves household income. So supporting people at that exact moment in time sets a kid on a lifelong trajectory of success, as well as that whole family.
Thank you. Is there any additional questions, Councilmember Martin? Okay. I have a question. How can the effect on poverty issues of diversity, such as ethnicity, disability, age, gender, sexual orientation, religion, be better understood and addressed? What relevance does, and you know, I got a second part to that, but I'll wait.
Well, I do think that I'm a big believer in the concept of targeted universalism, that there is a way to lift all boats, but the ones that are lowest need the most lifting first. So one of the wonderful things about the Child Poverty Reduction Act that passed is it focuses, for instance, on racial inequities, less so on the other identifiers you mentioned about disabilities and others, but it talks about closing the gap between black and brown children, particularly in New York State, who are at a much higher poverty rate than white kids are, the majority kids. So that would mean that the tax benefit, for instance, would be targeted to the lowest income families. It would be refundable, unlike the federal tax credit as currently constituted. So there'd be a lot more benefit to the lowest income families and also largely black and brown families. Other than that, I need to reflect on your question and think about a better answer.
I can put it in writing to you guys, definitely.
But I think it's a great point, and I think in all the policy solutions that we think of at the local level, we need to apply those lenses to understand what will be the tertiary impacts of any policy implementation and how we take into consideration the disparate impact among groups. Though poverty is overly represented in a lot of those communities that we're talking about, policy solutions do need to be tailored to meet unique needs. And so we think that does need to be taken into account.
Thank you. Thank you. And then my second part of that is, what relevance does inequality in the top half of the income distribution have for the reduction of poverty?
Well, there was a wonderful study quoted by Matthew Desmond in the book Poverty by America that says that if the top income tax holders in the country were not to pay more taxes, but just the taxes that they already owe, the number there, the hundreds of millions of dollars, exactly equals what it would take to lift every single family currently in poverty out of poverty. So inequality plays a very big role, but structural inequality, the way in which we let some tax cheats go, largely the wealthy who can escape their tax obligations. That is public money that, if spent wisely, could absolutely lift every family out of poverty, according to Matthew Desmond.
So what was the name of that book again?
It's called Poverty by America.
Poverty by America. Okay. Thank you. So if there's no additional questions, Councilmember Mitch Gruber is here. Do you have any questions? Okay. Okay, Councilmember Martin has a question.
So you mentioned the potential impact on childbirth around wages and work. Can you talk about initiatives like raising the minimum wage and how that may also assist with addressing child poverty in our community?
Yeah, I mean, most people in poverty work for a living, so they don't make enough at their job, just like the childcare workforce is currently making $13.55 an hour. So over 50% of childcare workers themselves rely on SNAP, WIC, Medicaid, childcare assistance for their own kids. So that's over $350 million a year that our state pays to support the public benefits of just childcare workers. It's an incredibly expensive problem, the fact that we pay too little. So the problem with that particular marketplace is it's a public good that's relying on a private market that's not going to work. Most other countries in the world have figured out it should be part of an education system that starts before kindergarten. We have not figured that out, and it's much to the detriment of growing poverty in our community.
All right, thank you. Thank you both, Larry and Emin, from the Children's Agenda for presenting, and also thank you for partnering with me on this much-needed initiative. The next speaker, give it a couple of minutes for you guys to switch up, or a couple of seconds, I should say. The next speaker is Quatisha Britt. Quatisha Britt is a parent advocate. Thank you very much, Ms. Britt, for coming today, and you can go ahead and start.
Thank you guys for allowing me this opportunity to speak on such a great topic that is a very great passion to me. My name is Quatisha Britt. I'm a parent of a 6-year-old daughter named Azalea Britt. I am also a parent leader and a parent advocate for the Children's Agenda group called VIP, as well as the Parent Leader Training Institute, PLTI Cohort 12. Within 41.7% of all children in the city of Rochester live in poverty. The majority come from Black and Latino families. We know that racial disparities, despite economic hardship, has placed families like myself and other families living in Rochester into a bucket of what is known as living in poverty. We as a community need more money to live, as well as proper mental health services and access to all community resources. Within the influctuation of prices, it's impossible to feed our children consistent, healthy meals. Parents struggle with keeping food, clothes, as well as safe homes for our families. Safe homes definitely is a need of Rochester. I am a single mother who from time to time go throughout each month and have to use our community resources to get by. If we as a community doesn't make these resources known to everyone, we will lose them. Just like programs that Rochester has called Project Launch through the Young Child Wellness Council, which was a program that helped me and my daughter when I needed my car fixed, as well as other things to make it through life. The program provides support groups for parents as well as parents to be partnerships in the community when changes was happening. The program allowed families to apply for up to $1,000 with help for everyday needs. If we had more programs like this that sets families up to want to do better for themselves as well as their families. With these resources, we can start to work to get out of poverty. If we keep taking things that we are working for, how are we as a community going to help families improve their quality of lives and overall difficult challenges that they might be facing? Rochester is very resource rich, but we don't have access to all resources and services that we need. We need to start our healing our community and get out of poverty. Thank you.
Thank you. So I'll take the privilege to start off with questions. I'm very impressed with your testimony. I'd like to know, how did you get involved with this type of advocacy?
Thank God for the Children's Agenda and the Children's Institute. Also, I worked in the city school district. I was a one-on-one working with children that had all type of challenges throughout school. In that process, I was introduced to a lady named Carmen Torres. When I was introduced to Carmen Torres, she explained to me the importance of parents and our voice and how we have to speak up for ourselves, because there's a lot of parents that don't have that voice to do that. So that what made me want to get involved in such a great thing that the Children's Agenda had going on called VIP. It's a parent group that we have on Facebook. And we go to Albany, we advocate for our children as much as possible when it comes down to situations that need to be changed in our community.
Thank you. So with that being said, what solutions would you want to see us put in place, or government to make changes to assist with the poverty? Like what you already wrote in your but what additional ones you might think?
We need more solutions for our children. Violence is another big thing that is going on in our community, and if our children don't have other outlets besides what we're giving them, recreation centers, sports, we need more mentorship programs. We need more of our leaders that are leading, that have businesses, to start pouring more into our children and our families so that we can start the healing process together, because if we don't work together to heal each other, it's never going to happen.
Thank you for that. To my colleagues, do you have any questions? President Melendez?
Yes, Ms. Britt, thank you very much for your testimony today. And I appreciate your story and your background. I think you are an expert in this issue in terms of understanding how it impacts community. What I'd like to unpack a little bit with you is, one of the things you mentioned is the amount of resources that could be available that maybe are not available, and you referenced a particular organization that was essentially providing resources, cash in hand, to people who needed it when they needed it. One of the things that the City of Rochester has done in the past, and we have not re-upped this endeavor, but is very similar in concept to that, in terms of having universal basic income, some basic cash payments that happen every month, and there's no questions asked, right? You're part of a program, you get a check in the mail or whatever the process it was, every month for a year. And we're still going through the evaluation of that, but my assumption is that the people who have been part of that program have seen better outcomes for their family, for their health, for their children. So I would like to maybe get some reaction to you. What do you think about those types of endeavors where it's really focused on providing the resources directly to the family, and what impact you think that can make?
Good thing that you brought that up. I sat at that table with those group of people to also give my input on what the city is trying to do as well. It's a great thing, but at the same token, we have to not put so many stipulations on us as people, because with the system being already set up the way it is, it's all paperwork. And if you don't have that paperwork, how are we talking about healing our community? How are we going to reach these people that can't use their voice to say, listen, I need help? How do I even find the resource to apply for that help? How do I even know that help is available? So we have to find ways as a community, and with me being in PLTI, Core Heart 12, my community project is to start working with the city of Rochester to make our resources more accessible for our community, because we have plenty of resources. We just have to get them out to our families so that our families can utilize them and be able to start fixing and healing.
Thank you, Ms. Britt. I would offer that I would love to help you with your PLTI project.
Thank you.
I think that one of the challenges always in government is the connection directly to people, and how do we do a better job of removing as many barriers as we can possibly remove so that the constituents that we all work for are able to benefit from the services of government. So I certainly will follow up after this, but thank you very much for your time.
Thank you. Councilmember Martin?
Yeah, echoing my colleagues, thank you so much for being here and for your advocacy. I wanted to ask you a bit about the role of housing and poverty through your lens. I think you touched on that a little bit when you were speaking. And as we experience a housing crisis in our city, you're on the ground, you're in community with parents. Can you talk about the impact of the housing crisis on our youth, as that's one of the symptoms of a poverty of a community that's stricken by poverty?
I used to live in the Conkey Avenue A Harris area for 4 years. It was a lot of violence, a lot of things that we as a community we could have stepped in and fixed, a lot of homelessness, a lot of drug activities that were happening right in front of our face. And us as a community, we have housing, but we need better housing. Landlords and tenants need to work together to figure out how can we fix the housing situation, because thank God right now I was blessed in the situation where I'm in a 3-bedroom with me and my daughter. We're paying $650 a month for rent. It's not a lot of housing in Rochester where you're going to get a 3-bedroom for $650 a month. Yes, granted, my house is not the best of what it needs to be, but I make it livable and suitable for my child, because I know if I was still in that area where I lived in that 1-bedroom, it would be worse. So to have more secure housing, more housing where landlords work with the tenants, the city works with the landlords to provide structure and programs and more things as far as nice windows, doors, things that we need that people don't think is a must for us as being parents to provide for our kids. If our living situation is not okay, then our mental situation is not okay. If our mental situation is not okay, then how are we supposed to be able to make sure our kids are okay? So we have to work together to make sure housing, we have too many empty lots, we have too many abandoned houses that are just sitting here with nobody living in them, and we need to find a way to upbuild our community back so not only our wealthy people have nice houses, that our low and middle class families could enjoy those same benefits.
Any additional questions? Okay. Thank you very much, Ms. Britt, for coming today.
Thank you, guys.
So we'll take some time to change it for our next speaker, which is Meg Morris, Executive Director from ACT Rochester, from the Rochester Community Foundation. You may begin.
Thanks. Hi, good afternoon. Hello.
Hello.
So I want to talk a little bit about the descriptive statistic that we most often use when we're talking about child poverty, and that's the childhood poverty rate. So First, ACT Rochester has been monitoring and making public the City of Rochester's poverty rate for over a decade now. Our poverty report in 2013 highlighted a contrast in Rochester's childhood poverty rate at 46%, while the national average was 20%. That's a difference of 1 in 5 kids nationally to nearly 1 in every 2 young people here in Rochester. That was in 2013. ACT updated the statistic in 2015 when the census reflected an increase in our childhood poverty statistic to just above 50%. ACT put another report out in 2016 when the childhood poverty rate was 52.5%, the highest rate in the last decade. One thing to keep in mind here is that all of these numbers have a lag time, so the 52.5% was for 2014, even though it was in a 2016 report. Anyway, the takeaway from these ACT Rochester highlights is clear. Rochester's childhood poverty rate is abysmal. The context for these abysmal rates compares us to similar sized metro areas and finds consistently that Rochester is among the 5 worst. From the 2013 report to the report in 2016, the poverty rate was increasing. Since the 2016 report, the childhood poverty rate has decreased, finally dropping below 46% in 2021, and in 2022, we have a 41.7% childhood poverty rate, the most recent census data currently available. We also know that this childhood poverty rate in the city of Rochester disproportionately affects children of color. We know while the overall rate is declining, that the inequity by race ethnicity is not. Please see the line graph of childhood poverty by race ethnicity on the ACT Rochester Community Indicators dashboard. It's both important and alarming. Additionally, and here's what I really want to highlight, is that it's worth reviewing some of the behind the scenes facts about the childhood poverty rate, what actually goes into that number that we all could be reminded of. I know I can often. One is the US Census Bureau, who puts out all of these numbers, defines childhood poverty as the percent of children under 18 who live in family households below the federal poverty level. So this tells us 2 things. One, childhood poverty is, by definition, about families. And 2, these child poverty numbers are likely not capturing unhoused populations. The Census Bureau uses money income thresholds that vary by family size and composition. So if a family's income is less than the threshold, then that family and every individual in it is considered in poverty. People considered family must be related by blood, marriage, or adoption. Another thing to note about this number is that the official poverty thresholds do not vary geographically, so it's the same threshold here as it is in New York City, but are updated for inflation. Also, the official poverty definition uses money income before taxes and does not include things like capital gains, tax credits, or non-cash benefits such as public housing, Medicaid, and food stamps. On the handout I also provided a list of what the income does include. It's a long bulleted list, and I don't want to put everyone to sleep, so I'll spare you that. But to name a few, unemployment compensation is included, as are rents and income from estates. The poverty rate also does not include changes in standard of living, out-of-pocket medical expenses, the impact of taxes, or geographic variances in the cost of living. It also does not give an idea of the extent of struggle for those in those circumstances. This information is helpful for us to remember as we track our trends in the childhood poverty rate over time. So something like the fact that the rate has been increasing is not something to celebrate at this point. ACT Rochester is the home of our region's Community Indicators Project and continues to monitor poverty rates as well as other indicators on our website. One of the things I wanted to alert us to, though, is let's be particular and intentional about the language we're using and the statistics we're including when we're talking about these things. One of the things that I noticed when I moved back here after being away for a while is that people say the word poverty as though they mean one thing, and it doesn't, right? It's a conglomerate of a whole bunch of things, and if we're going to want to address each of the ones in particular, we can still use the poverty rate as a macro descriptive, but let's be more specific about what we mean as we're trying to tackle things. Please check out actrochester.org and do not hesitate to reach out with any questions or if ACT can be of assistance in your data efforts.
Thank you, Ms. Norris. You got my wheels turning. I'm thinking about like some discussions we had. I sit on the board for American Heart Association as a board member, and today we discussed how poverty, the inequities of poverty, creeps over into medicine, and how in the same districts where there's poverty, the same districts is where there's a lack of bystander CPR. So, my wheels is turning is how do you guys collect your data? I mean, I know you mentioned that you're using the Census Bureau, but what other data collection methods are you using?
Yeah, that's a good question. So it's a lot of the census that does their American Community Surveys, the ACS surveys, and we use the 5-year estimates, which basically is just law of large numbers stuff, right? You get a bigger sample size, it tends to get better. And then we do use a bunch of the agencies for New York State. So we use a bunch of state level data. And that's kind of it for now. One of the things that's interesting to me is that if we could be more specific in some of what our questions are, if we are more intentional about the language we use,
Right.
then we can make a better argument for why we should be collecting more primary data. Most of my peers that do these things across the country do a lot more primary data collection that we don't have, and they're better at asking the specific questions.
So the takeaway for me is that we just got to be more intentional, have a more intentional discussion. The language needs to be more intentional across the board. And then I guess our colleagues, we all should be using the same language, right?
Yes.
Okay.
I would love that. You would make my life.
Okay. President Melendez?
Yes, thank you, Vice President. Ms. Norris, thank you for your testimony today. One of the other things I heard you say is that a lot of the data does not capture unhoused populations. So one can then assume, based on the data we currently have, that the numbers are actually worse than. Is that? I guess the question is it a safe assumption to assume that the numbers could be perceived to be worse based on the fact that we're missing a segment of the population?
I hesitate on worse because I think what it means is we're not capturing everything, right?
Sure.
So worse would be a question of the denominator. So it's how many would we include in the sample representation to make it so that it was enough that it would change what the percentage was, right? So unhoused populations are notoriously difficult to capture for a bunch of reasons, and it would make the statistic worse if it reached critical mass so that it's enough of the denominator rather to influence. Does that?
Yes,
Okay.
that makes sense. That helps. In terms of the action that comes from the data, I know that there's many efforts that utilize ACT Rochester information to then target a particular issue or concern, and sometimes it's programmatic, sometimes it's in a specific neighborhood or community. Could you speak to how you partner either with nonprofit and or other government entities to take the data but then inform whether it's a legislative body like us or others on how to effectuate change using the data?
Yeah, thank you for the question. So this is actually something that we've been evolving with particularly since June when the new website came up, but also over the last couple of years in particular, which is that we recognize that the level of data that we have right now, partially for what the Vice President and I were just speaking about, which is that we don't have those more intentional specific questions, is that our data is still at a bit of a high level, right? When we want to make changes and making policy changes, we want data to be at the most local level possible. So it would be better if we had neighborhood level data, if we had primary data collection, right? You want to make sure that you're doing what the constituents that are actually there, as opposed to what some fancy math sort of imputed that is there, right? So I've been trying to have more conversations about doing those deeper dives and getting to the point of asking the questions where we would know what kind of survey, what kind of direct collection we wanted to be doing. We've had that conversation. We had it at the event to launch the new website in June, and we continue to have it. We're having it across partnerships with a lot of the nonprofits that we work with through ACT as the data initiative of the Community Foundation. So we do it a lot through our contacts in that way. And then I know, Miguel, you and I have spoken about it. We have some joint ventures with the city of Rochester as well, where we're also trying to do that. But it's in the process of trying to be more intentional and trying to get data that's more on the neighborhood level.
Great,
Kind of answered your question. Kind of.
Yeah, no, that's helpful. And
Yeah.
my last piece here is more of a comment. I had a chance to dive into the Common Ground Health Color of Health report. And what's not surprising, but certainly interesting, is when you look at all the different health disparities, the map, if you start to map it out and you look at it that way, you see that the poverty, the health disparities, even things as basic as internet access are all the same map. And to me, it's just really frustrating that, you know, we can see all these things, but trying to figure out the mechanisms to get to the root causes and action is where I'm hoping we start to take this conversation. So I appreciate your time today. Thank you.
Thank you.
Councilmember Martin?
Thank you so much for being here today and all the work ACT Rochester does and has done over the years. So my question is about the specifics you mentioned. I'm curious about like what you had in mind. What are some of these specifics that you're referring to? And in addition, what are the possible issues with how certain language is used, and how can we be more aware of those things?
Yeah, sure. It's a big question, so I'm happy to follow up on it as well. I'll just say, you know, reflecting on what my colleagues have said already, right? We've covered things like mental health. We've covered the color of health, and I want to be very clear that my colleagues at Common Ground cover a lot of the healthcare disparity and healthcare data and information stuff. We do not. ACT is aligned with the focus areas of the Community Foundation, but one of the things we wanted to do is make sure that our dashboard includes direct links so that we can have a one-stop shop for where all the resources go. But in our conversation about poverty, right, we've talked about that. We've talked about health disparities. We've talked about mental health. We've talked about education. Then we've talked about housing. One of the other things that comes up a lot is environmental justice and sustainability, right? That comes up a lot. We talk about economic development. That comes up a lot. All of these things are also their own particular things, right? But they're also under the umbrella of poverty. And when we say poverty, I just get worried sometimes that when we say poverty as though everyone knows exactly what we're talking about and we mean all of those things, it gets lost in the wash a little bit. So when we're using more specific language, we can say, okay, we're still going to talk about that umbrella, and we can talk about the maps that Miguel was talking about, but we also want to narrow down a little bit to be intentional on how we're going to intervene.
I appreciate that lens. Thank you.
Yeah.
Thank you. And I was piqued when you said something about the dashboard. You have a dashboard on your website?
Yeah.
And is that up to date, like real time?
It's up to date per census. So
Okay.
it's up to date. There's a lag time of about a year and a half now.
Okay.
But the good news is census should be out with the 2023 numbers for the 5-year should be December 12th. So hopefully those updates, they will be on the website December 12th because unfortunately I'm not a robot, but they will be up shortly after.
Okay. That's good information. So we'll keep an eye on that dashboard.
Perfect.
Okay. Thank you so much, Ms. Morris, for coming. We appreciate the work that you do and look forward to continue to work with you.
Thank you for inviting me.
So next up, we will have speaker Dr. Ashley Cross from the Hub 585. Give Dr. Cross a chance to have a seat, and we'll get started in a moment. Thank you for joining us this evening. Dr.
thanks for
Cross,
having me.
you may begin.
Great. Good afternoon, City Council, and thank you for the opportunity to speak about an urgent issue impacting our community. Today I want to share insights that I've gained about the connection with poverty here in the city of Rochester and families' involvement in the county's child welfare system. Since 2022, Hope 585 has provided over $280,000 in emergency cash assistance for 324 Monroe County families working towards reunification or working to prevent their child from going into the foster care system. We've also provided cash assistance to every single young person aging out of Monroe County foster care. Additionally, we've served 1,556 children through our Care Portal network. that connects 500 community members with families involved with CPS. Through the Care Portal, we've made an economic impact of over $729,000. Through the past several years of working with families involved with poverty and engaging in statewide efforts to narrow the front door to child protective services, I'd like to highlight some of our learnings. First, roughly 70% of the families that we serve through cash assistance are employed. So we know that parents are not struggling to meet their basic needs because they refuse to work. They're struggling to meet basic needs because they're working low-paying jobs. Second, 52% of Care Portal needs are focused on resources that will help a family struggling with poverty prevent their child from going into the foster care system. These are items such as blow-up mattresses, clothing, lock boxes for medication, toddler beds, and baby gates. Hope 585, we meet nearly 70% all of the requests made by CPS workers, and the needs that are not met, we pull those families in for immediate cash assistance. We also know, because the data shows us, that communities struggling with poverty also experience the most CPS investigations. This can't be because poor people just happen to be more negligent parents. It's only because our systems are designed to judge and penalize the poor instead of identifying the root causes and addressing them. New York State requires for mandated reporters to report anything that appears to be abuse and neglect. The state's definition of neglect includes statements like failing to provide sufficient food, clothing, shelter, or education, failing to provide proper supervision, guardianship, and medical care. These indicators of neglect are often directly correlated with poverty, and as a result, thousands of families endure intrusive CPS investigations, not because of intentional harm, but because they lack the resources to meet these basic needs. This is the hidden harm that our community must address and talk about more openly. In fact, we've also learned that New York State spends $341 million a year on investigating innocent low-income families. In Monroe County, each investigation costs an estimate of $2,400. Last year, Monroe County investigated over 7,000 families, with roughly 20% of those cases being substantiated. That is 5,600 cases that were unfounded, and a waste of over 13 million Monroe County taxpayer dollars. Not only wasting taxpayer dollars, but also wasting child welfare workers' time, resources, and ultimately attention. Their ability to respond to real child abuse is compromised every time they have to conduct an investigation on a family simply struggling with poverty. Through conversations with families living in poverty, we've learned that many of them feel their experiences with child welfare investigations did not provide the support that they hoped for and never addressed the issue that targeted the investigation in the first place. Mandated reporters often make reports with the intent of connecting families to resources and assistance, but families frequently share that investigations left them feeling scrutinized rather than supported. However, CPS does utilize Hope 585's Care Portal to meet the basic needs of families, but we're on a mission to extend this resource directly in the hands of mandated reporters. Aside from the fact that we know that poverty triggers CPS investigations and the risk and safety concerns that poor families face funneling right into foster care, our policies choose to penalize these families instead of supporting them. In case in point, current legislation requires for families with children in the foster care system to pay a mandatory foster care maintenance fee, or what we would call child support. This not only places a significant financial strain on thousands of families, but also prolongs the separation between families and their children. As poverty-related challenges are amongst the leading factors driving involvement in the child welfare system, this is unjust, counterproductive, and unfair to families who truly love and want to raise their children, but are caught in a cycle of generational poverty. Childhood poverty does not only deprive children from basic needs, access to safe neighborhoods, and opportunities to attend well-resourced schools. It often steals away something even more precious, the chance for children to grow up with their families, celebrate holidays at home with loved ones, and grow up in the neighborhoods that they call home. Instead, poverty frequently forces children into a bureaucratic system that openly acknowledges its inability to provide the nurturing environment that every child deserves. It's a heartbreaking cycle that strips children of their roots and leaves lasting scars on their futures. This cycle of poverty and displacement not only impacts the emotional and social well-being of children, but it also comes with a staggering cost. Consider this. 10 years in the foster care system at the lowest room and board rate of $35 a day is a total of over $127,000. If the same child spends five of those years in a residential placement or a group home, that cost skyrockets to a minimum of $500,000. So what's the solution? First, we have to stop viewing CPS as a resource to addressing poverty. It's not, it never has been, and it never will be. CPS is not equipped to tackle the critical needs of children and families struggling with poverty, definitely Black and brown families. Instead, their focus should be on protecting children facing genuine maltreatment and abuse. We're overloading the CPS system. In closing, I want to point out a few very specific solutions that I believe would be a great start for the city of Rochester to help narrow the front door to Child Protective Services. The first, I believe that all children born in Rochester who are in foster care, regardless of their placement location, should be included in the city's Child Savings Account program to ensure that they have equal access to opportunities that can change the trajectory of their lives. Number two, we should work on educating mandated reporters and the broader community on responsibly reporting to CPS, emphasizing the importance of distinguishing between genuine concerns of abuse and neglect and issues stemming from poverty. Third, we should help families struggling with poverty achieve reunification by supporting legislation like the Senate Bill S7054B. This will allow families struggling with poverty to reallocate their resources towards achieving reunification goals instead of paying the county child support. Four, I believe that prioritizing system-impacted families and cash assistance programs to ensure their economic mobility. More than 7,000 of those families who undergo CPS investigations each year would substantially benefit from cash assistance and cash transfer programs. And lastly, New York State requires mandated reporters, and lastly, to invest in community-based resources with proven economic benefits and cost savings, shifting the focus from costly crisis intervention and family investigations to proactive solutions. So I urge you all to act boldly, to invest in families, and to invest in hope. Thank you for your time.
Thank you, Dr. Cross. I'm a mandated reporter twice over, a paramedic and a teacher, and I can see, where you're going with that. And I never even thought about the implications of how it would affect a family, because the first thing they said, there's no food in the refrigerator, those type of things. Is it poverty or is it abuse or is it neglect? And as a mandated reporter, they don't have us make those assumptions. You just report based on the criteria they give you. So it sounds like we need to overhaul the mandated reported system.
We need to definitely rethink mandated reporting, and I've been involved in the New York State mandated reporting work group that's really working on redrafting the bill, which would start with redefining neglect.
I'm very interested in learning more about that. That's good. That sounds like good work, and it sounds like it's responsible work, and I'd just like to learn more about that as you continue to roll that out.
Absolutely.
Thank you. I'll defer to my colleagues with President Melendez.
Yes, Dr. Cross, you said a whole lot here. Whole lot of facts here. So one question I have is related to the relationship that you have with the county. So I know that there's a lot of work that 585 does with the county in collaboration to try to support families. In your advocacy, because I know that's a two-way street, right? You're providing support, but there's also the advocacy component. What is the current appetite for these conversations at the county? Given our role as city legislators, I certainly want to go and have these conversations as well with my colleagues in the county legislature, but I do want to understand where we are in terms of having these critical conversations around these issues, particularly pertaining to CPS.
Yeah, I think that county leadership is open to these conversations. They've always been open to the conversations with me. I mean, again, it's a bureaucratic system that's not going to change overnight, and county workers are very overwhelmed with the demand, right? So we start talking about mandated reporters and helping empower mandated reporters to use more discretion and not reporting poverty. CPS is on that all day because they also don't want to investigate, you know, mom doesn't have food in the refrigerator. Well, instead, let's get groceries instead of wasting CPS workers' time and energy on situations that are not real true abuse and maltreatment.
Yeah, so in that vein, you know, your last recommendation was around community-based resources with proven economic benefits and cost savings. And I'm just using that very example you just gave. Instead of penalizing someone for not having food in the fridge, what if we bought groceries, right? So thinking through those types of solutions, I guess one question I had, and I'm going to give you the magic wand question. What is you think the most basic things that we could be doing from a community resource standpoint that you think will impact poverty at the family level?
Yeah, well, I think we have to look at why mandated reporters are reporting, you know, first. So again, with the cash assistance program, 70% of our 70% of the people coming in are employed, right? So for us, it's been a little disheartening that funders believe that a lot of the people coming in for cash assistance are not working, so we need more workforce development programs. Although I do believe that that's helpful, it's not that people don't have jobs or don't have an appetite to work. And also addressing the housing. Many of the checks that we write to families are to eliminate evictions or to prolong their stay somewhere or to help them find new housing. So we have to address housing because that is a major issue and it triggers a CPS investigation. But again, it's poverty, but a mom cannot stay in her car with her 2 children and that not end up triggering a CPS investigation. But it's also no reason that a child should be removed.
Well, I could ask you a million other questions, and I will follow up, but I appreciate your time tonight and all the work that you're doing in our community. Thank you.
Thank you.
So you did trigger a question that I have as a result as a follow-up. So you mentioned these numbers are staggering about the investigations. You know, the numbers, you know, numbers don't lie. You know, it tells a story, a picture that the investigations yield only like, I think you said, is it 20%?
20% substantiated.
So in the meantime, until we receive some relief or, you know, a change, what do you suggest could we do to help mitigate that number, like they bring that number down? Is there something that we can do collectively to bring that number down?
Yeah, I honestly think having more conversations with mandated reporters around reporting, right? So, and we do have data that shows where the most reports come from. I'm not able to share that tonight, but at the right time, I think being able to provide immediate intervention into those places that are doing the most reporting and help empower their mandated reporters. One thing is that mandated reporters are afraid of losing licenses. A lot of these people are their social workers. They're making sure that they're not putting themselves in any type of risk by not reporting. Right. So again, short term, it's really important. It's empowering mandated reporters to feel more comfortable, one, knowing the community resources, because if our mandated reporters, if social workers that are working in the city, don't live in the city, don't do community work in the city, they don't know where the nearest food bank is, they're looking to CPS as the resource. And I think that that's one of the first things that we can do is help for people to understand that when they trigger a CPS investigation, CPS is not showing up with bus passes and groceries.
Right. Wow. And, you know, it puts it all in perspective because you wrote in here and you said it. We cannot continue to use Child Protective Services as a default response to poverty. And, you know, I think about that. I'm like, okay, you know, there's a million different reasons why things are not happening in the household. It could be they don't have a washer and dryer. CPS is not going to provide that.
Right. And you know, not to go off on a tangent, but the outcomes for children who are in the foster care system, aging out of the foster care system, they're not positive outcomes. And so I think that mandated reporters need to have an equal amount of fear, right? We should fear that one child falling through the system and experiencing abuse or death. But on the other hand, we should also fear putting a child in a system that cannot meet their needs either. And the outcomes are no better than many of the kids growing up with their families. And so I think that people look at CPS or the foster care system as this savior system that's saving kids, and it's not.
Okay. Well, that's good feedback. I mean, I'd love to have more conversation around this with you, Dr. Cross, and learn more, and also engage our county partners. I'll go ahead and yield to Councilmember Martin.
Thank you so much for being here, Dr. Cross, and all the work you're doing in our community around the CPS issues. I've been following along. With all that you mentioned and what you prepared ahead of this meeting, I'm struck by it sounds like there's just this gap, right? The reporters are well-intended. They're hoping for something that the system at this time is not equipped to provide, and your organization does a great job of filling that gap. It also reminds me of policing, right? People call 911 because they want to help someone in a mental health crisis, but the only institution essentially mandated to provide that service are people with a badge and a gun, not equipped to provide that essential mental health service. So I guess how do we, like, what are your ideas around how we create something that bridges that gap where people can call someone else for food, for the necessary items that families need, without triggering this like life-altering involvement of CPS?
Yeah, I think that's a great question. I think we take the similar approach that we took in the development of the PIC team, right? We knew that law enforcement was not equipped to handling mental health challenges with community members, so there was an alternative that was created that can create that barrier between the system and our community. I think the same exact thing needs to happen with child protective services, right? We know that there are times that law enforcement is needed. We also know that there are times that they're not. And it's the same exact thing with CPS. There are children that are harmed that need immediate intervention. We need to free up the system and create a barrier between our community members, specifically Black women, and CPS. And so I think that we take the same approach in creating something that does allow for community members to call, as well as mandated reporters feel supported. I think that people need a mandated reporter or some type of community advocate to walk them through the process of finding those resources. But I think it's the same exact approach, and the systems are very similar.
Amazing. Thank you so much.
Thanks.
Well, thank you so much for a wealth of information, Dr. Cross. We'll certainly be in touch, and thank you very much for coming today.
Thank you.
The next speaker is Candace Cabral. Candace is a parent. She's an advocate and also is a member of the New York State Child Poverty Reduction Advisory Council. Welcome, Candace. When you can go ahead and start once you get situated.
How you doing, guys? Hello, everyone. I'm a proud mother. I want to start this story off telling about myself before I start telling about my children and why I got involved with the community. My mom is a Puerto Rican person that came from Puerto Rico. My dad was a person that came from Dominican Republic. He got deported before I was first born. So I'm from New York City. So when I think about my mom being abused and being addiction, and she was a nurse provider too. So she also was a street worker too. So when I think about her coming to Rochester, living in a shelter right across the street from the Cadillac Hotel, to me that was everything to her. Trying to change your life for your children, trying to fight to make a change for your children. For me, that's where it started, guys, from the shelter. But when I say I changed from 15 to 16, I went to the group home system. My mom was telling me to go buy drugs for her. So instead of me going to buy the drugs and going to get the drugs, things happened to me. So I got into the foster home myself. I want to say I went to Auburn, New York for a year. I turned 17. They forced me to go back to my mom. Even though I went through all this counseling, guys, and got all the support, did everything in school, did everything I needed to do to succeed, my mother wasn't. So all in all, the court system put me back with this lady. My mom literally, when I got back home, I got kicked out. I was 17, now I'm homeless. My mom moved to Florida. So now I'm out without, I don't have Social Security, I don't got a birth certificate. I'm a kid at 17, almost 18, trying to go to welfare to get assistance. So when you're going to welfare and you don't have these things, no birth certificate, no Social Security, that prolong your case, your situation, not being homeless anymore. So for me, guys, I wanted to say that's where it started for advocacy. Learning that you had to fight for yourself, knowing that you had to stick up for yourself, knowing the challenges that you had in your community. So now moving along, I have 4 beautiful children. I have one that's 19, one that's 17. And when I say 8-year-old and a 7-year-old, they're my life. They give me motivation. They make me be the stronger person for our community. When I look at them, I see other kids in our community, but I also see myself, what things I went through in my life.
Okay.
So advocacy part for me, guys, I started with our MAPI. I can say I started for the Board of Education. I started for Healthy Moms. A lot of these organizations, I went there because I needed a hot meal or a bus pass, or I wanted to get out the house to get support for me and my children. So a lot of these organizations that I went through, and Salvation Army was always there for me too. So I want to say all these organizations helping you for your children, spiritually, mentally, financially, house assistance, it made me be the more advocacy that I wanted to do for my kids and make them show that this is what your mom want to do and the legacy she wants to leave to make a change. And when I mean making a change, guys, I mean public assistance. Y'all know it's been broken before our kids, before our time, our parents. It has to be a change. When we think about housing, it has to be a change. We think about not be able to buy a home, not to see our children be able to see us purchase a home, not to be able to see all these houses vacant, 80,000, and you not to be able to afford it. It's very hard for you to look at your community and say that you want to see change when you don't have these presented in front of you. So I'm standing here as a mom, and guys, this is my whole life when I go to Albany, and to get to sit there in front of these people that don't know and haven't been through the system like I have been in my children or other people just like myself. So it feels really good to be there, but it's nervous too, because when you get out there, you don't know what you're fighting for and you don't know the documentations. But you do want them to know that what they have going on in the system and what we have going on now, it's not what the people want. It's not what we're asking for. Even my children say it. They're high schoolers. You're talking about us, but we're not at the table. So we need them to be more at the table, more speaking. But I'm really proud to be at Albany, guys, because I see the change, and they're listening to us. When you see my testimonies, you tell your story because you want people to listen and understand that we have a voice just as well as a person that went to college, a person that has doctorates. We want to be a part of the change and want to make the solution. So every day when I go to Albany, guys, it's my life, it's my kids to make sure that we're going to make a change. We have to make a change. We can't keep living on to make sure that this is not going to be designed for our children. This is not for our children, and it is. When we say we're here for the people and we say we love people, we want to make sure we're giving them the best opportunity, and that means giving them opportunity while they're in school, making sure they can honestly get trades in school, guys. We need our children, black, brown, Latinos, every race, to make sure you're walking out with a trade, because all kids don't want to go to college, but we need to make sure you have something behind you to make sure that you're making your own business, you're making your own entities. Because me, I didn't get to finish high school, so I wanted my kids to know that you need a license, you needed to make sure you finish school, and I have one graduated, guys. So for me not to be able to do those things and to see my children and see other children and to be on part of the advisory boards and councils and see parents trying to fight for kids to go to college and to make sure they're eating while they're in college, making sure they have funding and things that they need. It's bigger than what we want for us parents. We live in a 3-bedroom apartment. We're scared to move. You can't afford to move. Even if my son's working, they count that income. So even if you don't have a father in the household, my son's 19, they consider that is a whole person making income. When I was 15, 16, 18, that house was cheaper, guys, compared to my son getting an apartment and getting a house, a career, and having it now. So if we're trying to stop the statistic, we don't want them to make the same mistakes we're making, and we don't want the public to actually keep going longer and longer we have. So what we're trying to break, you have to help with the school. You have to help with homes. You have to help with the statistics that we have, the organizations that we have now. We need more funding for our children. We need people like myself to be able to be a part of that funding and making those decisions, but also having those jobs. So when you see our kids seeing parents like myself being that lived experience and having those opportunities, those are bigger for our kids to say. You won't have the kids. You won't have the kids that stand at the corner because they see their mom saying that we live here, we're a part of our community, and we're making a change. Thank you.
Thank you, Ms. Cabral. I am so just inspired by your passion. I work at Franklin High School, and it's just a breath of fresh air to hear your testimony. I serve a lot of the youth that you just mentioned, and I do believe in CTE, Career Technical Education. I graduated from Edison, and in Edison Tech, everybody that came through there, you got a trade, you got something when you left there, and I think that that is the way. Whether you want to go to college or you didn't, you still got a trade. And those who went on to college still had that in their hip pocket. So I believe in stacking credentials, and that's definitely what we got to inspire our youth. And good for you for doing that. I appreciate it. The one thing that struck me in your testimony is you talked about the documentation. And I got to tell you, and I'll tell you a little bit about my story. I had an episode of homelessness, not as long as you had and not the way that you did, but I had a house fire and I lost all of my documentation. And I didn't know how to get it. It was like, you know, I felt like, wow. And then I realized in this county, in this city, that was like a vital function of being able to drive, to go someplace. And, you know, I lost all of it. And there was no easy way for me to get it back. What do you suggest that we in government should advocate to make documentation easier for those of us who lost it through fire or through any kind of way? Like, you know, even your story. How can we help our citizens obtain their proper documentation better, so it's not a barrier to getting their services and even a job?
Yes, ma'am. I think we have to cut down on the paperwork we're asking for. Knowing that some of us need birth certificates, Social Security, and it takes time. If we don't have the fund, if you're from Rochester, you can get your birth certificate here, but how do you get the funding for that? So just making sure we have someone covering that funding for someone. Mine was from New York City, so it was $15, but DSS, public assistance, helped me pay for that funding to be able to make that possible for that. So to me, knowing that, but also community health workers. Community health workers are the people that honestly is right by your soldier. That is me. I'm a community health worker. So when you see the person, you're literally taking the information, the data, and you're copying it. We need to track it somewhere. It's like a computer, a data space that we honestly should be able to keep that Social Security, that birth certificate. That doesn't change that document. And then the documents that you're asking for, bank statements, is some things that people don't have and some things we do have. So just making it fit for each person. If you're 65 and older, you shouldn't be asking for citizenships, youngin, and all this other stuff. But when you're an elder and you're a parent, you shouldn't be asking me even for my CDs or savings and stuff like that, because you're trying for your kids. And I feel like the more you have or the more you have less, it's not helping us. So I do want more programs to be able to help other people, more other people learning, but they need the data to be traced for somewhere else to be transferred. Like if it's there in the computer, we should be able to use that data. We shouldn't have to come back to Section 8 or DSS to bring you birth certificate, Social Security, if we constantly been with you for over a year or 2 years. So tracking that data and making sure it's okay. We're limiting some of the information that we have on the paperwork, like one time or every 6 months.
I could see that, like when you go to the hospital, all your medications are already in the system. Not only your medications, but your all your information, your background is there, and you signed to have it transferred, but it's there. So I got you. I understand. That's a great idea. So I got another follow-up question. Is you said so much, and I just want to make sure I capture this question. You seem to have, actually it's more of a comment. You seem to have a roadmap on how to navigate through the systems. And I really wish there was a way that we can capture your roadmap, or what I call an algorithm, to help folks who are in need. I don't know if you've ever been able to map that out, but I think you should, and share that with us and the community at large.
I think a couple of times I have been, like our pantries. I know you see it at the libraries, but our pantries say a hot meal. So it's like color coordinated. I love color coordinated things. So anything I'm putting in calendar, it should be pantries you can go. If it is somewhere you can go, like say if it's heating or someone you need, we should have a list of information so you can directly find it. Soon as when you look it up, it should be something that we have that you can be. And we did a lot of prototypes. Our MAPI is I love them so much because they do so many prototypes, and they ask men and women. So when you come from incarceration, how do you feel what the prototype should be and what you think information should be, how we capture it, what we're saying with the wording. Is it only for women? Is it appealing for women and men? So you want to make sure we're capturing everything for a person and statistically wise. But I love color coordinating, and I love information everywhere. And word of mouth with each other goes a long way with each other.
Thank you for that. I'll start with my president of City Council, Miguel Melendez. Questions?
Yes, thank you, Vice President. And Candace, you are everywhere, by the way, in this community. I mean, I I think I probably met you volunteering somewhere, probably at Conkey and Clifford or somewhere over there. And I just appreciate that your spirit is always giving to the community. One of the questions I had for you was related to your experience with Section 8 versus shelter allowance. And I know this is not, quote unquote, a city issue in terms of government, but it certainly has an impact in the city. The amount of resources that are available to people who are looking for housing. And in my view, Section 8 obviously is a more expansive option, but I'd love to hear from you about your experience in that process and what you think needs to change, in, either with shelter allowance and or Section 8.
Yes. It takes you to get a long time to on Section 8, like maybe 2 or 3 years. The waiting list is very long. I feel like when you're on Section 8, they have a housing so you can be able to buy property, guys. But I feel like you should have a caseworker. You don't talk to your caseworker until the next year you're ready to certify. So in that process, in that year, you should be able to have a home, like, purchasing, getting step by step, to be honest, to be coming into your home ownership is limited. They just got funding recently, and you can honestly, I have a kid that's 17 or younger, so you can honestly take your kids and move into a prominent area. But one thing, I thought it was amazing. I thought that was going to be everything. As long as you find the house, you can find the area. Number one, a lot of us don't have transportation. It wasn't in the bus area, and the landlords didn't want us to honestly move out there. So I think they needed to fix that to make sure that whoever we're renting to, that they're getting a bonus, because we're moving into different neighborhoods that we're not likely mostly accepted to, and our kids are not. So that was really hard for us to honestly, and it took me a whole year to honestly look around Rochester, every east side, west side, north side, to find housing. And you needed to get a support letter. You needed to get different things to honestly move in these neighborhoods, and it still didn't work. And out of those, I say 20 moms, only 8 people moved out of Rochester to those areas. So I would love to see more of our family members to honestly move out of out of the city, kind of just moving into other areas that you would like to, but also making it available for us to be able to have more home ownership in through Section 8.
Thank you for that. As a city legislator, I want more people to move in, but I got you. I got you. One other question. So I know that you've had a wealth of experience in community organizing and different perspectives. So I'm gonna give you the magic wand question too. When you're in community and talking to people, and obviously you have your own personal story, but you also listen to a lot of other people. What do you think are some of the biggest challenges or barriers or opportunities that you would hope to see as City Council and other government entities tries to figure out how do we better address poverty, and specifically childhood poverty?
Hey guys, literally the same way we went for $15 and our whole community signed that bill, and it wasn't a government official, it wasn't down, but to me, I felt like we made a movement, guys, of Rochester, and we honestly can make a movement for our community now. I want to use Amazon just assistant. We can build as many Amazon, but if you don't have transportation to get there, or if the amount of hours you're working is not adding up to your paycheck, we're not making a difference. So we have to go back to the dollar. And the same way that the minimum wage went up, I feel like we can go up again as the community members. But we need jobs to honestly, the same way our housing, our jobs, everything has to play a role as you're working, and making it women and men. It's like both of us, we both want to be able to work in different areas. And growth, you need to be able not to have a high school diploma and be able to use your trade as well as your high school diploma to be able to get some of the positions that we're looking for in our community.
Thank you very much. And I just want to highlight, I'm not surprised by that answer, just because I know that you also volunteered for almost every employment fair that we had here in the city. So we really appreciate you helping connect people to opportunities. You have the floor.
Councilmember Martin.
Yeah, thank you so much for being here. I had a chance to read through some of what you prepared and presented, and you had a lot of great suggestions, some of what you've spoken about now. I guess one thing, so I'm a newer legislator, and I've been here for going on 3 years, and one of the things I've personally struggled with is just the apathy or the bureaucracy, things that are common sense to folks on the ground, right? Like just limit the paperwork, right? Make the services accessible are not necessarily how these systems function or work. So talk to me about, but you're still here, right? You're still here. I'm still here. You're still serving on the New York State Task Force. You still have hope. Tell me about what drives you to keep fighting, to keep showing up, and trying to make a difference in the lives of our community members.
Truthfully, I look at our kids, I look at my life. I love Michael Jackson. I love Martin Luther King. My son can quote him since number 9 school, since he's been a kid. When I look at my children and I see the difference, you want to empower them. Right now, guys, I'm struggling with Section 8, struggling with DSS. So I really want to change their mind to honestly not need those resources, because it keeps you in a box. You make 30% or you make $1 more, we're still struggling. A parent right now is making groceries, literally working. And the whole year you've been just making groceries, just to work, just to make groceries, you know, and you have 4 children. So a lot of us you're on the verge of either losing your house, on the verge of losing medical, or on the verge of losing your children to the system. So it's really hard when you look at the things we go, but I got to keep fighting, because I'm like, I don't want my kids to end up like that. I don't want them to be in the cycle. I don't want them to lose hope. I want them to know that somebody cheers them on all the time. I didn't have a cheer, so everybody needs to stand in ovation at least one time in their life.
Thank you. I appreciate the sacrifices you're making, and I look forward to connecting with you and really supporting you and community members in addressing these issues. Thank you.
Thank you. Thank you, Ms. Cabral, for being here. We appreciate your testimony. So the next speaker is Charisse Bufus Scott, Executive Director of Diverse Mosaics Community Center. Thank you, Kelly. Thank you, dear. I didn't mean that. Welcome.
Hello.
You may begin when you're ready.
Okay, thank you. Okay. So good afternoon, distinguished guests, community leaders, and advocates. It's an honor to be before you today. Oh, and Issa. So he's going to join me. Can't do it without the consumers. It is an honor to be here before you today to discuss the urgent issue of childhood poverty, a challenge that affects not only families in Rochester, but communities across the nation. My name is Charisse Bufus Scott, and I am the Executive Director for Diverse Mosaic Community Center. As a lived experience expert, a teen mother, former foster youth, mother of an autistic and ADHD children, Muslima, homeless survivor, and survivor of domestic violence, I have both a personal and professional perspective on how childhood poverty impacts families and what we can do to create real lasting change. When I come to the table, I don't just bring the voices of those impacted in the community with me. I incorporate my full lived experience. Allow me to share a piece of my own story, one that reflects the struggles faced by countless families in our community. Several years ago, my family was transitioning out of a domestic violence situation and temporarily living in a Hilton hotel, a safe and secure environment. Despite our efforts to rebuild, my family was reported to Child Protective Services, CPS, by our school district. The report stemmed from my 12-year-old daughter explaining why she was late to school. I had to return to the hotel to take her and her younger sister to school because she couldn't leave her sibling alone. The school labeled her as docile, incompetent, and not knowledgeable enough to stay at the hotel, unfairly stereotyping and condemning us based on our temporary housing situation. This report not only devastated us, but also highlighted the pervasive discrimination families in poverty face. Instead of being supported, we were scrutinized and treated as though our circumstances defined our worth. The emotional toll of this experience remains with me, but it also inspired action. It drove me to create Diverse Mosaic Community Center, a place where families navigating poverty, domestic violence, and systemic inequalities could find resources, advocacy, and compassion they need to overcome their challenges. Through my work at Diverse Mosaic, I have seen countless families face similar discriminations. Families living in shelters or temporary housing are often labeled as neglectful. Parents are judged for circumstances beyond their control, such as not being able to afford transportation, nutritious food, or access to health care. I've worked with youth who blame themselves for their family struggles, feeling responsible for their inability to buy food or to make it to school. Some of these youth have attempted suicide, believing they are burdens rather than children deserving of care and support. The emotional toll of poverty extends beyond parents to their children. No child should ever be left feeling responsible for their family's inability to afford basic needs like food or transportation. Poverty often leaves families without mental capacity to seek out complex network of direct services that they need, further exacerbating their challenges. For families in poverty, the barriers are endless. When you're struggling to survive, meeting even the most basic needs, food, shelter, education, can feel insurmountable. The system often expects families to navigate complex networks of services, yet fails to consider the mental and emotional toll poverty takes. It's not a lack of will, it's a lack of capacity when every moment is consumed with trying to stay afloat. The statistics. Childhood poverty is a multifaceted issue, but it's not insurmountable. Through lived experience, direct service, and advocacy, Diverse Mosaic Community Center is working to rebuild a Rochester where every child has the opportunity to thrive. Together with initiatives like Childhood Poverty Initiative led by Council Vice President Lachey D. Harris, we can challenge the systems that perpetuate poverty and create a future rooted in equity, dignity, and hope. Let us not underestimate the power of community and collaboration by supporting families advocating for systemic change and addressing discrimination. We can break the cycle of child poverty and build a brighter future for Rochester's children. Childhood poverty in Rochester has profound and far-reaching effects on families, contributing to a cycle of hardship and limited opportunities. Key statistics highlighting the severity of this issue include high child poverty rates. Between 40 and 46% of children in Rochester were living in poverty as of 2022, placing the city amongst the highest in child poverty rates nationwide. According to Rochester First, extreme poverty levels, Rochester has the highest rate of extreme poverty among comparable cities, with 16.2% of residents living below 50% of the federal poverty level. According to RACF, single-parent households challenges nearly 50% of single-family homes headed by women with children were below the poverty line in 2022, highlighting the economic challenges faced by these families. Rochester First highlights racial disparities. Poverty rates are disproportionately high among African American and Hispanic communities in Rochester, with rates nearly 40% and 44% respectively. Again, Rochester Area Community Foundation, Educational Attainment in Poverty. Individuals without a high school diploma experience poverty at rates about 5 times greater than those with college degrees, underscoring the link between education and economic stability. The Office of State Controller. These statistics illustrate systemic challenges that families in Rochester face, including limited access to quality education, healthcare, and economic opportunities. Addressing these issues requires a comprehensive community efforts and policy interventions to break the cycle of poverty and promote upward mobility for all residents. The impact of childhood poverty. Childhood poverty is more than just a statistic. It's a daily reality for thousands of families in Rochester. It manifests in food insecurities, unstable housing, and limited access to education and health care. The discriminations families face, coupled with systemic barriers, perpetuates a cycle of poverty that is difficult to break. At Diverse Mosaic, we see this reality firsthand. Youth living in poverty often bear emotional burdens far beyond their years. Families who have endured trauma, such as domestic violence, face even greater challenges, as these systems designed to protect them can sometimes cause additional harm. Discrimination compounds these struggles, turning a moment of crisis into seemingly endless battle for dignity and survival. Our role in the community, Diverse Mosaics Community Center, was created to address these barriers and empower families to overcome them. We provide wraparound services, including school transportation programs to ensure youth can access education and reduce barriers tied to poverty, mental health advocacy, training lived experience experts to provide trauma-informed, culturally competent support to families in crisis, emergency support services, for food, housing, and healthcare access. We are also at the table with local coalitions and councils advocating for policy changes at the federal, state, and local levels. We use our lived experience to inform decision making and push for systemic reforms that prioritize equity and dignity for families in poverty. Solutions to solve childhood poverty. Addressing childhood poverty requires a holistic solutions that tackle both the symptoms and the root causes. Our first suggestion is wraparound family support, which we do in-house. Families need comprehensive services to stabilize their lives, including food security, housing assistance, and access to healthcare and education. Trauma-informed care, training mental health advocates, and creating community-based healing models that can mitigate the emotional toll of poverty. Policy and advocacy, legislative efforts such as confidential reporting systems and the Family Miranda Act can protect families from discrimination and harassment while ensuring they receive the necessary support. Access to education and health care. Expanding Medicaid billing and transportation initiatives is crucial for removing barriers to basic services. In conclusion, childhood poverty is a multifaceted issue, but not insurmountable. Through lived experience, direct service, and advocacy, Diverse Mosaic Center is working to build a Rochester where every child has the opportunity to thrive together with initiatives like the Childhood Poverty Initiative, led by Council Vice President Lachey D. Harris. We can challenge the system that perpetuates poverty and create a future rooted in equity, dignity, and hope. Let us not underestimate the power of community and collaboration. By supporting families, advocating for systemic change, and addressing discrimination, we can break the cycle of poverty and build a brighter future for Rochester's children. Thank you.
Thank you very much. I really, Ms. Rufus Scott, I really appreciate what you brought to us today. And I'm very interested to know a little bit more about your policy and advocacy and how how you leverage, how you guys, how your company, your agency strategize to garner the parent center voice, their voice. What are your strategies to get their voice at the table and your solutions?
What are
I
my
apologize.
strategies to?
So your strategies to center parent voice at the table. What are your strategies? I saw that you had a few strategies in there, but I'd like to hear more about your strategies. I'm losing my voice.
One of the biggest strategies that we have is, depending on if it is a youth that is getting our sole focus or the parents. So we wrap around the whole family, not just one or the other. We do this because for long-term change, it has to be an environmental change. And how can you change an environment without including the parent? And how does the parent help change their environment without including their child? And without together coming up with strategies and healing supports to do that together. So we provide emotional emancipation circles, we provide meditative yoga, healing circles, we use the Sabwana model. We also utilize OCFS's peer-to-peer support and training. Again, there are some barriers to that. It is not, it's not the easiest training for community members, and it's not culturally competent to our community, but it does touch on needed skills that community members who are impacted by trauma, systems, CPS, all of the different things of why they are referred to us, because they're referred to us either through community or through grassroots organizations or through our youth services through Monroe County. So that is how we get our referrals. Oh, and yes. Some of our partners have already spoken, which was really nice to hear that elevated in the work that they're doing. So because we do direct service with impacted families, our peer-to-peer training, we are focusing and prioritizing training those people, not other people, not people from other communities, the people right here in our community that are impacted by the issues, that had to figure out the hard way how to come up with solutions. And therefore, and that's how we come up with our solutions, is the community. So I don't really know an easy way of answering that, because everybody within our organization has lived experience. So just to give you a little bit of further understanding, we took 53 participants from across New York State on a retreat over the summer. Honors Haven was the hotel that we utilized, which is like a healing type of resort. And we brought 10 people who had been impacted by CPS from Rochester. And then in addition, the 53 people made up people from Buffalo, Syracuse, Albany, and New York City, for those who are highest impacted in poverty and CPS reporting, because as Dr. Cross said, they overlap. So in that, we took movement building strategies from the community across the state. So when we are meeting locally and we're getting the voices of local input from families that are impacted, and we are creating resources for the community from the feedback that we're getting, which Candace touched on, we did have a solution to solve for that. Like that, we have to have something to be able to, like a directory, which we created, to be able to direct our clients and those people that we're engaging with, not just to, I'm sorry, I'm bouncing everywhere, but not just to meet their immediate needs, because we do the referrals for them and sometimes drop off clothing and food and beds or whatever they need, just to relieve that immediate stress, to give them that relief component. But teaching them how to utilize those resources themselves, so that they now become their own agency, and then they are now able to use their resources and the knowledge that they have learned to navigate poverty and navigate the city's resources for poverty, because they're so disconnected, right? To make that comprehensive. So again, taking all of that, we have movement building strategies to where hopefully the goal is to pass legislation across the state for all of these impacted counties, because while city council can focus on Rochester, the bigger issue is there are marginalized families throughout Monroe County. There are marginalized families throughout the Finger Lakes area, and a lot of this plays out with systemic racism and oppression, just due to the climate and the area that we're in. Absolutely.
And I really appreciate that you brought that up. That's the elephant in the room, in every room, right? I love the fact that you guys do a holistic approach. It sounds like a holistic approach, and then you guys, have navigators on site, and you teach your participants to become navigators themselves. So that's great. I'll yield the floor for my colleague, President Melendez.
Yes, thank you, Ms. Charisse, for your testimony today. I want to lead off with just saying that, over the years, I've been able to see from afar some of the work that you've been doing, whether it's Healthy Kids or, I know recently you've been involved with the Rock Against Gun Violence Coalition. So I just want to say thank you first for your time in advocating for community members, and not just community members, but people who have lived experience in these various spaces, and bringing that voice and elevating that voice. So I want to start there. So with respect to your testimony, one of the things that was prevalent was mental health advocacy. And the city of Rochester has dabbled in this space. I think we've done some good things, and there's certainly areas to grow. One of the challenges has been that, historically the city hasn't been involved in health-related fields, right? So we don't have a public health department. We don't have the Office of Mental Health, but we know that mental health certainly impacts our community, our constituents. So with crisis intervention and the PIC team and all those things being relatively new in their infancy, even though there's, it's 3 years, but in the scheme of government, that's new. What more could we be doing from your perspective to try to uplift the mental health needs and supports for community members? One of the things that we've done, just to highlight this, council did approve doing mental health first aid training for all of our rec center staff, for example. And that's just one component, but I don't know that it's culturally competent, and I don't know it's the right training. So I just would love to hear from you on what you think we could be doing more in that space.
You took the words out of my mouth. I have participated in those mental health first aid trainings, and although they are very informative, and I think they are a good resource in general, it does not touch on how you can engage children of color that are going through crises, and what that looks like, and what that means to them. And one of the most recent and biggest things that stands out to me is having a client. She took 29 pills of her ADHD medicine, and I can't believe that she is alive. Her family was in a full wraparound and getting the support that they needed.
Okay.
And this young lady still felt as though that it was her fault, that her family was struggling to feed her. And if she wasn't here, that would take away the burden. And while we're doing all these amazing things, I don't think the school district moves fast enough to partner with grassroots organizations. And I'm not just highlighting mine. They are amazing people doing this work that I have been trained under and follow and partner with, like Jackie Dozier, like Melanie Funches, like Dr. DeGrue, like Dr. Kia Nyambe. And a lot of their work and a lot of the strategies that we're bringing to address long-term solutions for people impacted by mental health, I don't think those are utilized enough. And I've made those things that are provided by the Black Psychology Association and the CHN network. We have fully embedded that into our work, because you're not just to treat poverty. To treat poverty, you have to treat the root. To treat mental illness, you have to treat the root. And if people have trauma due to epigenetics, and then trauma due to generational harm, and you're not teaching people how to cope, skills to self-regulate, and how to do a long-term behavioral change, you can give them all of the trainings that you want. They'll never be able to thrive in a work environment and be able to have a peaceful life until you teach people and you share with them those tools and resources to be able to move through their trauma and break down those barriers. I hope I answered that.
Yeah, no, that was very helpful. I think, one of the areas that I'm hoping we continue to explore and think more deeply about is what our investment is in this space. From a legislative perspective, one of the things that we control is the budget, and I think that there's opportunities for us to continue to invest more in this space, but I think the investment needs to be the right investment. So I think talking through with community about what could those be. And
to
yeah.
that point, I did speak with the Office of Mental Health's regional director for our area. And interestingly enough, the peer supports that they support, the two organizations that they support, are almost non-existent that are receiving funding from them. and they don't support the community. I don't think it's appropriate to share publicly, but I think they have one peer support that's supposed to be navigating mental health concerns in our community per organization, and they're not doing the job, and the feedback is really poor. So that was a personal reach out that they made to me, and they said, Sharice, make sure you do your credentialing and get certified, because this is a model that's actually working, when they came in and observed. So I would love to see divestment in white-centered organizations that were systemically designed to only help Caucasian families at the time, and they were not designed to help Black and brown families. And now they're trying to incorporate and weave us in, and we can feel that. We're not a priority.
Thank you. I yield the floor.
Thank you. So I got time for one question. Oh, go ahead. I'll start with Councilmember Monroe and then Martin. If you can please keep it to one question, because we're running tight on time.
I'm
I
sorry.
appreciate it. Thank you.
Hi, thank you for being here. Dialectical behavioral training, when it's done, with families, do you find that that also has a problem as far as not being able to reach out to people of color, or is that more of a kind of a neutral, client-led process? If I don't know if you use it.
I'm sorry.
That's the DBT, the dialectical behavioral training. I don't know if you use that, and I just wanted to hear if you do, what your opinion is on the cultural competency piece of it. I mean, if it is culturally competent.
I am not familiar with that. I have a CBT approach, and then I use the African-centered approaches that have been given to me by those doctors who have spent decades working and fighting for people of color to be acknowledged, and to really touch on post-traumatic slave syndrome and the harms that people of color have endured over our time span in America. So I don't know if that's answering your question, but we have a very, we don't use, the only system that we use to be able to bill Medicaid is the OCFS peer-to-peer training.
Okay.
Everything else is from the community, data-driven for cultural competency.
Okay, so not something that, I mean, I know there are all different kinds of approaches out there in the mental health field. It's not something like, EMDR or DBT or something like that. So no, that's
CBT, we use tapping and do you know what an emotional emancipation circle is, or a Sabwana healing circle is?
No, I don't. I'm not familiar with the healing circles.
Okay, so so my organization can send you information about it to be able to educate you a little bit more, and then maybe that will answer some of your questions. And we follow closely under some of the works of Dr. Joy DeGroot.
Thank you very much. And yeah, I'll reach out to you, because it would be nice to discuss offline.
Thanks you.
And Councilmember Monroe, if you have additional questions, we've been, we can put them in writing and send them to them too. So let our staff know. Councilmember Martin.
Hi, Sharice. I'm so grateful, like my colleagues mentioned earlier, for all the work you do, how you show up in so many different spaces. You're constantly at it and going. As an organization that primarily provides services to folks of color, can you talk about some of the barriers you see with funding to support your services versus some of the organizations that primarily serve or primarily have worldviews aligned with, systems of white power structures, Yeah, it's sometimes difficult to see, the folks on the ground doing some of the most work to serve through a culturally competent lens are the least funded, the least supported, the least taken seriously in our community, and yet they provide the most impactful services to Black and brown folks, Black and brown youth. So talk to me about your lens around that and how, knowing that poverty is a policy choice, how council and other legislators in our community can make intentional investments.
Well, I think you kind of named it, Councilmember Martin. We are extremely underfunded, and we are overlooked for a lot of opportunities. And the work that we do is devalued a lot compared to our counterparts. Like I mentioned, it took OMH to come and tour what we were doing and see us active, to compare it to something else that is very well funded in the community. And those organizations, I believe that money goes mostly to staff. I'm grateful for the support from Councilmember Kim Smith. I am grateful for, we actually get more support from outsiders outside of Rochester, outside of Monroe County, more than we do right here locally. I think that a lot of it has to do with friendships and ties to personal agendas or whatnot. And it's really disappointing to see a perpetuation of poverty going away. I do partner with Ashley Cross, where when she has the funding, families who are impacted by CPS can get a $600 stipend. It's only a one-time thing, but for families that are transitioning from homelessness, domestic violence, we have clients that have kids that have been arrested for guns or stealing Kias or whatever the case may be. These families need help too. Like, they're not doing it to be menaces. They don't think that they're a menace to society, right? They think that they're doing something that makes sense. And most of these kids don't know where their next meal is coming from. So I think during COVID, we had a lot of solutions for poverty, and I feel like we should go back to some of those things that worked, and to reduce the recidivism, and to be able to reduce the recidivism and to make a way for families to meet their basic needs. And so if you look at the data during COVID, child harm was significantly reduced, and CPS reports were severely reduced as well, due to the influx of cash that families were able to get. And of course, the hybrid model caused the issue for students, but all of these things are solvable if we choose to solve them and reallocate our resources.
Thank you so much.
Thank you. And I do suggest walkthroughs of organizations too, to see if they're actually doing what they say that they're doing. That would be nice. Thank you.
Thank you very much, Ms. Buford Scott, for coming and joining us today and providing us with that testimony. We appreciate your efforts. Next up, we have Mr. Wayman Daniels, the next speaker from Rise Up Rochester. And Rise Up Rochester is from Baber AME Church.
First of all, I'm going to say you guys are quick. Made me a name tag already. And I just found out a half hour ago I was coming here. Heard a lot of numbers that were being presented. Poverty.
Can you please speak into the mic, Mr. Wayman?
Oh, I'm so sorry.
Thank you.
Did a symposium years ago when Lovely Warren was mayor, when Mr. James Norman was the CEO of Action for a Better Community. And at that time, we had the president of the University of Rochester doing the symposium. And they were talking about the war on poverty. At that particular time, I was an intern at ABC to be a chemical dependency counselor. I was dressed up in a suit. Didn't look like I was impoverished. And they said, what does poverty look like? So I threw a number at them, $23,000 and below. Because if you looked at me, you wouldn't have never knew that I was on social service. You wouldn't have never knew that I was dependent on a system to take care of me until I finished school to get my certification as a KSAT counselor in chemical dependency. And one of the persons on the symposium says we ought to feel good about spending $64 million on the war on poverty since 1964. That sounds like a lot of money to you and me because we don't make that much money, but to a corporation the size of the United States of America, that's just a drop in the bucket. So when I look at these numbers and the average person it takes to raise one child is $237,000 to raise one child. So when you look at that, when you have two children, it goes up to $300 and some odd thousand, and so forth and so forth. So as the numbers of the dynamics of your family grows, the more money you're spending to raise a child. So is it all about giving me $18, $20 an hour to assist me to take care of my family? Because at those numbers, I still can't take care of my family with $25 an hour. That sounds like a lot of money, but it's really not. So I heard all the numbers. I come here and talk about, again, just a small cod in a big, enormous wheel. I don't have all the answers, but I have just part of a small part of the answer. If we can invest so much money in fixing schools, $100 million to revamp a school, why can't we invest some money into educating our children and our families on how to get out of poverty? What does that sound like? What does that look like? Educational opportunities. Again, the table. A lot of them don't know the language of the table. So to invite someone to the table that doesn't understand the language, I'm speaking algebra, and they're speaking at a third grade level. It's not going to work. So I come to this from a personal experience, but also from a professional experience, because I was that one that was not stealing kids, but I was sticking people up. Did 7 years in the state penitentiary, was sentenced to 20 years in the state penitentiary, got kicked out of school. I was that problem. Wanted to commit suicide. That's the personal experience. But when you talk about a community, you're talking about, when you break it down, it says community. If we can come together as legislature, as a community, and start working together as a community, then we'll see change. I work in a field where a lot of agencies are running for the bag. They want the money, but where's the commitment behind the money? We can't even come sit down at the table as a collaboration and talk about being a solution to this problem. Our kids are hungry, man. I just took a little kid out to a restaurant yesterday with Rise Up Rochester, one of my mentees, 18 years old, been shot 5 times. The young man dropped his fork on the floor. That wasn't the irony. The irony was he picked up his fork, was getting ready to wipe it off, and continue to eat. But I had to show him we don't do that. Go get another fork. My point being is that they don't know. So how can we teach them how to know, those that are in a position to help our community and not just talk about it, but be about it when no one's looking? I was walking down the street with my little 6-year-old daughter, and a man tire literally came off his car while he's riding down the street, rolling across the street. I told my daughter to go in the house. And as I'm helping that man put on his tire, whom I did not know, but I got out and I helped him put on his tire. Then the next door neighbor came out and helped. That's what we need to do. Because we can throw all the money in the world at the community. But if we're not getting out there as individuals and showing personal empathy, it'll never work. So if my children are hungry, can I go to you and say, yo, can you help me? I need help. That's what the community needs, is help. But we have to show them through our example that it's okay to ask for help. There's nothing wrong with being a man asking for help. There's nothing wrong with being a parent asking for help. I don't know everything. I got to depend on him, who is my coworker and the people that I work with, the community, to help me. Our G&E bill might be $7,000. How do I get help paying that? I get behind on my mortgage or get behind on my rent. How do I get help with that? Had one of my coworkers back there saw a young man with no shoes on. He took his shoes off and gave it to that young man and walked barefoot. This is what our community needs to see. See, I don't want to talk about it, but I want to be about it. I want to live what they need to see. Harriet Tubman said it so profoundly, they gave her the credit for it, but then again they say she didn't say it. I could have freed a lot more slaves if they knew they were slaves. How can you be 18 with a third grade reading level? You in the 10th grade only got 2 credits, but I'm waiting for you to age out. Poverty is bigger than just throwing money at it, because money couldn't help me. What helped me was love. Someone reaching out to say, I'm a servant, and I'm not doing it for the applause, but I'm doing it because I care about you. So I can sit here and say, okay, we need more funding. I can sit here and say city council's not doing. No, man, I'm not here to complain, but what is the solution? Rise Up Rochester wants to be a part of the solution. We're not going to complain about what we can't see. The late Kobe Bryant said it so profoundly. He said, if I had pulled my hamstring and my children upstairs and a fire's breaking out in my house, you think I'm going to think about my hamstring hurting? He says, but I'm going to save my children because that's all on my mind, not the pain that I'm going through. I feel the pain of our community. I feel the pain of our young people. But the fire of violence, the fire of poverty, I can't allow that to cripple me from wanting to help them. Even sometimes when they don't want that help, I still have to be that conduit that's there to help them. So Rise Up Rochester wants to be that conduit, and we work very hard to be that conduit. I hear a lot of people talk, and I back up. I believe a man's word is everything that he has. And anywhere I go and I talk to the city school district, I talk to the charter schools, and we talk to other agencies and other people in our community, I throw a word out there that you don't hear too much. I promise you, if you trust us to help you, we're going to give you 100%. In other words, I'm telling you to put me at my word and put me at the test. If we don't do what we say we're going to do, call us out. You don't hear that. You hear these cliche words, I love you, I have compassion for our people, for the community. What does it look like? I don't want to hear your words. I had a father tell me the other day that his 2 children, 12 and 14, has been let down so many times by agencies saying that they're going to help. After we leave here, guess where we're going? We're going to sit with him and his sons, and I told him yesterday, we're not going to be like the rest, but we're going to show you that we support you. Have a person whose child is in the mental health institution right now. Even though he's not a part of the Boys to Men's program, we still support that family with support and love and resources. See, it's not about being seen. I was talking to Lynette Adams today, and she was asking me about certain things. I said, I'm a behind-the-scenes guy. I'm not looking for attention. I'm not looking for an applause. I do it because I love our people. I love our community. And poverty is not ethnicity. Poverty touches everybody. White, black, Hispanic. It's not just for the black family. It's for every family in the city of Rochester, Monroe County. Numbers, man. 60%, 200 and some odd thousand population in the city of Rochester, 60% of that population is impoverished. That 60% is not just black people. It's everyone. So how can we make a difference? We used to do public service announcements. I think we need to start getting back to that and start talking to the people. Average person watches television, social media outlets. Let's make a campaign for that. We're making a campaign to talk about everything else, the Kia boys, the gangs, and so forth and so forth. We're investing so much money talking about that, putting fear into our community. Let's invest in our community and say, you know what? We have these organizations, we have these agencies out here that can assist you. A lot of people don't know about the resources.
Mr. Daniels, if you can,
ask them about the
if you
resources.
can wrap up. If you can wrap up, please.
Okay. Rise Up Rochester is here to serve, and we want to do it 100%, and we do it with a smile. We do it just your way, like they said at Burger King. We serve it just your way with love and empathy, but with professionalism.
Thank you. I really appreciate your testimony, what really struck me is what you mentioned about how it can't be just about money. It has to be love. It has to be the simple things of what you do when no one's looking.
Right.
That's most important. Are you helping your neighbor when no one's looking? Are you feeding a family when no one's looking? And that's the stuff that resonates with me as well. I got a question. What differentiates the effects of poverty on youth and young adults in terms of the impact, both their own quality of life and that of their families?
Well, if we ever take the time to sit down and listen to them and talk to them, City of Rochester just done a thing on poverty a couple weeks ago, and I thought it was so beautiful because the children have the answer as well. We can't continue to overlook them and think that they don't matter, but listen to their voice. But also the key component for me is to guide them and to show them how to become entrepreneurs even when they don't see hope, even when they don't understand the language of hope. They don't understand. They don't understand that I'm fighting for a block that's not even mine.
Right.
We at Rise Up Rochester created curriculum talking about build your city. What does that look like? That city is individually me. If I want to create a city on the outside of me, but I first got to start with me, but I need to know what it looks like. So we need to educate our children. When I say educate, just give them the information. We have the information. We have the plan, but where's the execution? That's what we're lacking, execution.
Thank you for that.
You're welcome.
So I'll yield. I'll ask my colleagues if we can just keep it to one question. And what we'll do is we'll take additional questions in writing and we'll submit them to Rise Up Rochester. President Melendez.
Yes, thank you, Vice President. So I know a thing or two about Rise Up. Appreciate the work that you all do and that Wanda does day in and day out. My question is around, I know you said that it's not about resources, but on some level there are needs for additional resources. And what does that look like in the context of Rise Up Rochester, right? So what is if you could identify a gap in service area, or where there was if you had some additional resources for the relocation services, like what is the thing that you think Rise Up Rochester could benefit from in terms of serving the people?
I have a colleague that's sitting in the back, and again, we can throw all the services we want, but if we don't teach people to have a change of mind, because being in the drug field, you can say people, places, and things all you want to and put me in the suburbs, as long as I still have the same mindset, I'm still going to use. So if we can assist the people with the change of mindset and then show them that relocation can work, because again, it's easy to throw money out there and say this works. It's easy to say that. Domestic violence, you can say, okay, we put you over here and take you away from your husband, but if you're still attracted to a person that's still doing domestic violence, we just moved you from one location to the next, but you still have a hunger for that, something that you say you hate. So my thing here is to give people that view of what hope looks like for Rise Up Rochester, because money is not everything. Our families didn't have everything, but they showed that love and compassion towards one another, working together as a unit. And I think even though I can sit here and say the cliche words, give us more money, would that solve the problem? No. So.
Thank you. I'll start with Councilmember Martin and then Councilmember Monroe.
Yeah, I think a lot of your responses have pointed to the nuances of poverty and the importance of, a multifaceted approach that thinks about the individual, their mental health, the general community, like, is the community okay? But my question for you is, can you say more about the connection between families and youth who are economically disadvantaged or impacted by poverty and the trends of violence we see in the city?
Well, I can sit here and say that, again, from personal experience, I grew up in poverty. So in order to escape what I was dealing with, I got gang involved. I became very antisocial because I didn't want to deal with the pain of seeing a single parent mother. So I went to school to have fun. I didn't go to school to get an education. So that dynamics is sometimes people act out because they don't want to deal with these certain situations, and they put on many masks of violence and being tough and hard. So that dynamics is very big. I don't want to just say childhood poverty, but again, the parents are affected by this. So if we can help the family as a holistic approach, but how do you do that? You have to put it in such a way that to their mind that it makes them have a hunger and thirst for it, but you got to let them see that it's real, it's obtainable. They're not seeing it. They're seeing me being bougie, not talking about me per se, but I'm making this type of money, I'm doing this, but when I look at you, I don't even speak to you. That's crazy. I went to the LBPTA golf tournament a couple years ago up in New Jersey with the top golfers in the world. And they didn't look at me nor speak to me, anyone that was on that resort. And I said, when I get back, I'm going to make people look at me and respect me and know that I'm there. How do I do that? Through education. I educated myself, but not only that, but having pride in who I am. But not only that, but having and fighting to let them see me. But then again, not even caring if they see me or not. So how do we get to that point? Again, showing them what hope looks like and sounds like. And that's through an example. Miss Martin, my daughter might want to commit suicide walking through Kmart one day and you don't even know her. And she's only 6, but if you can say, hey, I love you and how you doing, that can change the trajectory of her life. That's what we're talking about. We're talking about putting action not behind an organization, but action behind who we are as human beings. Because we're looking for an agency and an organization to save us, but we can save ourselves. See, I can't make excuses and start labeling other entities for what I think they should be doing. What am I doing? A village. It's a community. And it starts, the Bible says charity begins at home. That's what we should start doing. PSA's about that. Mm-hmm.
Thank you. Councilmember Monroe?
I don't have any questions for you, but I so appreciate the fact that it is getting at the root and the soul of people, and especially when you're talking about kids and the fact that when you're there for them and showing up for them, a lot of times they're not going to want you there, or they're going to act like they don't want you there because they're ready to be rejected. And so I appreciate you putting this information out there and see how we might be able to help, because mental health is real, and how we start to address it is something very doable, people to people. Thank you.
All right, thank you guys.
Thank you, Mr. Daniels, and tell Wanda which way we missed her today. Okay. So next up is Speaker Sean Burr, Chief Executive Officer from Rochester Housing Authority. And just to give you a note, this is our last testimony today. We have one more? Oh, never mind. I apologize. we have one more after this. I apologize. Mr. Burr, you can go ahead when you're ready. Welcome.
Excuse me. First of all, I applaud you for your efforts, and thank you for the opportunity to be here. I bring to the table the perspective from the housing side of things, but also different perspectives. When I started at the Housing Authority in 1991 as a housing inspector, I inspected Section 8 housing for 9 years. So I got to meet a lot of people of all walks of life, and really helped mold the efforts that our organization has strived to be able to provide to help people on their path to self-sufficiency. In a perfect world, we would be a stepping stone, assisting folks for a period of time while in need until they were able to become self-sufficient. And to a degree, we accomplished that with our self-sufficiency programs that are voluntary for housing authorities, but we feel strongly enough that it's important not only to our participants and our residents, but also to the community. And part of that is our home ownership programs. So with the self-sufficiency programs, it's a voluntary program not only for the housing authority to participate in. We do have to apply and receive grant funding. It's not enough, so the housing authority is committed to the success of the program. So we set aside and budget monies to be able to, make that program successful as it can be. Currently, we have 178 participants in that program. To hear the stories when the successful graduates, we have a ceremony that celebrates their achievements, and to hear their stories is very heartwarming. And it's a true testament to the dedication of our staff that works one-on-one with folks who enter into the program. It's a 5-year commitment. They sign a contract to achieve the goals that they establish in that program. And it is to become self-sufficient. We just had a recent graduate who increased her income by over 1,000,000%. We have homeowners of, we've almost reached 300 homeowners since we've done our home ownership program. So we're working toward providing opportunity for folks to get out of poverty, to enhance and better their lives and themselves. We have demonstrated the success, as I said. We have many resources in the community that we partner with to help achieve their goal, for participants in this program to help achieve their goals and reach that level of self-sufficiency. Whatever that be, it's different for every person. Be it education, be it employment, be it home ownership, amongst other goals that they may have. And it's challenging. It's very challenging for folks. It's not an easy path, but for those that are committed, it's wonderful to see them and talk to them when they've reached that status. One of the things that I've learned in my 30-plus years at RHA is it comes down to kind of two things. Lack of awareness, which we're working hard to improve that, with only 178 current participants out of a potential 12 or 13,000. It doesn't sound like a lot, but it's quite a path to get to that self-sufficiency stage. But we need to increase our efforts and awareness. I think that goes without saying, community-wide. But, talking to the people that I've talked to, whether it be residents, whether it be program participants, not having a clue about some of the programs that exist out there. And I kind of found that in my own life, to be honest with you, if I go back in time. But we don't need to go there. But nevertheless, I think that's something that we can do a better job at community-wide. The other thing that if I had to pick two things that I've learned is fear. I think fear plays a big role in poverty, and people are fearful that they're stuck there, that there's no way out, and that's not a good feeling. A lot of folks that I've interacted with, are employed. They have jobs. They support their families, but they're afraid to get to that next level, which brings them out of eligibility for the assistance that they get through our Section 8 programs or our public housing. There's not a safety net there, and that's something that I've talked to legislators about. Where's that safety net that allows somebody a cushion once they reach that threshold, whatever that income eligibility threshold is, right? So if they make $10 more, they're not going to be eligible to participate in the program and receive that assistance. Well, what happens 6 months later, once they're off the assistance, at $10 more, and they lose their job, or there's a cutback, or something else that affects them. They go back to the beginning of the line, that they have to wait and apply for assistance again, wait 5, 10, whatever years to be reached on a waiting list. So those are the types of things I think that we could do a better job at. We have a resident services department that administers the grant for the self-sufficiency. Imagine if we had a community-wide resident services department that provided the resources, or somebody could go there for resources. A table of contents to show all the resources that people could be connected to, and to assist them in whatever they need assistance with. So those are some things that have always been of interest to me in what can we do better as a community? What can we do more of? Increase awareness, help diminish that fear, provide a path. And somebody else was talking about that. I think you asked somebody to provide that pathway that they had in their head. Actually, I want to give her a job. But nevertheless, yes, Mr. Cabral. But nevertheless, there's a lot of opportunity there. I think there's a lot of good things in motion. We have, and thanks to council, that we're going to be doing a deep dive into the families that we have who are facing eviction. And, housing authorities, public housing used to be known as, for many years, as the housing of last resort. Well, I think we've changed that. And we're on a mission. We have an initiative to change the face of public housing. We're making great strides to do that. Because just because it's public housing doesn't mean it has to look like public housing. And we're putting out units that are better than the house I live in, which is fantastic to see people in their joy when they move in there. But it doesn't have to stop there. We need to do a better job of getting people to that next step, that next level, and that's what we're striving to do. Participating and being aligned with the city's FEC program. Just to throw some numbers out there, we have just in 2023, we had over 140 people, RHA participants and residents, be connected with FEC, Financial Empowerment Center, for those that aren't used to acronyms like we are, which resulted in 344 counseling sessions, resulted in $310,000 in debt reduction. It's an important thing, and also $70,000 in increased savings. That's the nice accomplishment. That hasn't always been there for us. So we're making strides, and that's just an example of one. And I think we're on a lot of good paths. But to connect that all together and have that under one umbrella, I think could be a huge, huge benefit and success to our community. I'll stop there. Oh, how am I doing?
Well, thank you.
We got time for questions. I know you got.
Thank you so much. I'll keep my question real tight. What solutions would you advance for housing stability for the people in the city of Rochester? What kind of solutions do you think we should implement?
Well, the Housing Quality Task Force is, came up with our recommendations for that. I think we're on a good path forward for that. Landlord-tenant relations, huge need for that. How to be a good tenant, education. How to be a good landlord, education. And the importance of building that relationship and having a good relationship builds stability. People stay longer. People have with better relationships. That I've in my experience have seen that through us and our own properties that we own, and with our Section 8 programs with private landlords.
Thank you. I'll start with President Melendez.
Yes, I'll try to keep my questions tight too. Benefits cliff, and when you get to that making $10 more than the allowable amount, how much of that is dictated by federal standards or other standards, and how much is within the control of RHA to maneuver when someone reaches that number, right? So I'm just going to say this out loud. So I'm making $10 more than what's allowable. I'm on a path towards self-sufficiency, but I might need 6 more months of stability before I can fully transition into whatever's next. Is that cliff going to cut you off right then and there, and you have to move, or what's the period, and what does that look like?
It's not like you have 60 days to vacate your position, right? But no, there is a cushion. It depends. Each case can be different depending upon how much over the income limit you are. But there isn't a long enough period of time, in my opinion, for anyone.
For the record, what is the general period of time?
Unless all of a sudden you're making a lot more than that threshold, right? But
sure.
Let's use that $10 example. There's not enough time. There's not for that cushion. It's could be 6 months.
Okay.
Right, until you're going to be off the program.
Got it. Yeah. I have a lot of questions, but in the interest of time, I'm going to yield the floor.
Feel free to put those in writing, and I'll go to Councilmember Martin, then Monroe.
Yeah, thank you for being here and for the service RHA provides. So working in the housing space and working with people who are primarily impacted by poverty, can you talk about the significance of providing quality housing on youth and the outcomes and their ability to thrive? I think it's one of the most significant areas that is overlooked a lot of the time. but we know it's important.
It is. A stable household, I think, is huge. Is one of the biggest things that can get people out of poverty, right? Not to mention the other benefits. There's health benefits. There's a lot of different benefits. Habitat for Humanity has an interesting statistic. I don't remember it, but it was in the mid 90% of their homeowners' children graduated from high school. That's huge. If you think about that, that's huge. 90-some%. Yeah. So I don't know. I don't know if that is still true today. I'm probably going back a number of years when I heard that, but it always stuck with me, and it really gave credence to that stable household model. And it wasn't just home ownership goes a long way, right? And you're building intergenerational wealth, and we fully support the homeownership program, which is a voucher homeownership program, where the voucher can assist the residents with their mortgage. And interesting stat, so out of current homeowners of over 200, we have 70 below the 30% AMI. It's probably the only way that anyone below the 30% AMI is going to be able to own a home. So, yeah.
Thank you. Councilmember Monroe?
Hi. What is at least approximately the waiting list right now for a space in an authority?
We have multiple waiting lists. Okay, we have multiple bedroom size waiting lists in public housing, so it's a mixed bag of it could be depending upon what preferences that you might have and be eligible for. Disabled is a preference, and there are others. It could be anywhere from 6 months to multiple years. Our Section 8 waiting list that was just opened this year and closed, what we've done there is, it's funny when I started, like I said, in '91, never thought I would be here to be able to make this sort of a difference. But what we looked at, I don't know how many years ago now, but our waiting list had been closed for almost 10 years. And we still had thousands of people on the waiting list. Right? When we opened it, we said, well, we're going to send an example. We're just going to take everybody that applies and put them on the waiting list. It was over 17,000 people. Wow. And it got to be, I started looking at data. Well, how many people are we pulling off the waiting list? How many people that are on the waiting list are successfully being issued a voucher? And it was like 15%. Well, that's a waste of time for us and for them. The contact info had changed and so on and so forth. Well, so we put our heads together and said, what about if we opened our waiting list and only took 3,000 people and turned it over? And at that time, we were housing about 1,000 people a year, issuing vouchers to about 1,000 people a year. So, okay, in 3 years, we'll just do it again and provide a rotating basis and provide more opportunity more frequently. So we've stuck with that model. It's 3,000 to 4,000. I mean, this time it was 4,000 because we had a little bit of a delay called the pandemic. But nevertheless, we feel that it's better managed, more efficiently, and in that period of time, we're going to go through just about all the applicants. So.
Thank you. That's very helpful.
Mm-hmm.
Thank you, Mr. Ver. And now we will head on to our final but very esteemed last speaker, and that would be Ms. Rosemary Rivera, Executive Director from Citizen Action of New York. I remember Ms. Rivera from my days with SEIU, so it's very happy to see you. Okay. You may begin.
Well, first of all, I think that I am between you and dinner because my stomach is grumbling as well.
Okay.
So I have a very long type of statistical stuff here. I'm happy to give it to you. Instead, why don't I just have a quick conversation and just tell you, poverty is not a new issue. We've been working on poverty in this country forever. Here, again, just in case I want to throw a stat in. And then supporting wealth creation and economic success, it's the brownstone and the foundation to building more equitable and inclusive communities. New York State, I think the combined cost of rent and childcare is outpacing inflation right now. And those two things are really driving residents out of the state. It's not driving the millionaires and the billionaires out of the state. I will tell you that we have increased the number of millionaires and billionaires in New York State, in the richest city in the history of this country. We really have increased the number of millionaires and billionaires, and Rochester actually has quite a few of them. But instead, if we want to resolve poverty, the thing I always say is, well, you know, the money's there, it just happens to be in the wrong pocket, right? Let's think about that. I think about childcare workers. So the Children's Agenda talked a lot about childcare workers and what they're making now. We entrust our children, our most valuable asset, to childcare workers who make less than what you could make at a fast food restaurant. Think about that. How many people are staying there? Most of them are women of color. Single household breadwinners are predominantly women of color. The other thing that I wanted to say is I run a statewide organization. We do a lot in terms of changing policies. And one of the campaigns that we hold is called the Invest in Our New York campaign. It is a coalition, but we hold it at Citizen Action of New York. We brought in over $10 billion, yes, $1 billion, that's with a B, to New York State through raising revenues, closing corporate loopholes, et cetera. And I think it's absolutely necessary for us to continue to pass resolutions throughout the state, because think about it. The city, the state, and the federal government, there is interplay between all three. Councilman Melendez talked about, I have a budget. I want to look at my budget and see how to best use the dollars within that budget to serve the residents of the city. I heard Sean Burr talking about, that I used to be a commissioner in the Rochester Housing Authority. I was hoping that he would be talking a little bit about what's the impact and what we can foresee, especially in the moment of time that we are in. We are in a moment of time where the federal government, we know that in the last Trump administration, the low-income tax credits were at the least. That means for development and affordable housing in New York State, it would actually shrink. What and how are we thinking about using the dollars in Rochester? Because right now we're in a crisis of multiple crises. We have a crisis on housing, we have a crisis on childcare, we have a crisis of mental health, and the list goes on, right? And so at this point, money does matter. Yes, I love love. I swear if I could, I'd give everything to every single person, but I can't do that in a macro level. And so government has to take a responsibility at this point to figure that piece out. We are supporting the milk bill. So we've been doing a lot on the milk bill. And we're supporting something called gate money, hopefully in a way of trying to get people to understand that we should be moving towards a UBI, right? Especially in the moment of conjuncture that we're in this country, in this state, and in this city. So I do not want to stand between you and dinner. I'm actually hungry myself, but I do want to say, maybe I should say something here. A key takeaway from the recent election is the absolute necessity of advancing a working people's platform. So I think about all the stats that people talked about today, about the number of people in poverty, and I bet you 10 to 1 that most of the people that are in poverty are also working. So a living wage would be essential. Raising the minimum wage, thinking about living wage ordinances. How are we hiring at the city level? Who are we hiring? Can we have, what are the ways that we can do that? And to counter the extremism of anti-government propaganda, individualism, and targeting of the other, We must demonstrate that working together, we can achieve tangible progress towards sustained and equitable economic recovery for all, centering the priorities of those most impacted and working at the intersection of race, gender, and the economy. However, to accomplish what may seem to many as a Herculean task, we know it is the super rich. If the super rich were to pay their fair share in taxes, this task becomes a lot easier, particularly because the city government needs state funding. The state depends on, I was looking at the Fiscal Policy Institute website today, which was sharing how many billions of dollars actually we're expecting in 2026, and what can be shaved either through regulation or through legislative action. Those with legislative action will take a little bit longer, but there are possibilities in terms of regulations at the federal level that will have serious impacts in Rochester and beyond. And just to say one more thing is, I am also somebody who I was a child of New York State. New York State was my mother and father, and I can tell you that New York State's parents suck, and that's why I constantly fight them. I am totally committed to this and to Rochester. I love coming home. Thank you.
Thank you. I just want to say I'm very happy to see you. It's a pleasure to have you and your testimony today. Thank you for waiting. I appreciate it, and I'm going to be very quick, and I'll pass it to our president.
Yes, thank you very much. First and foremost, I want to say thank you for your work. Your name precedes you all across the state. I was in Amsterdam for work at Ibero, and your name came up a couple different times in a couple different spaces. So thank you for your advocacy work across the state. With respect to what we can do in city government, one of the things you mentioned was living wage ordinance. And I know a few years ago, and I'm going to challenge the chief of staff to go back and let's look at this, but I think we passed or contemplated a living wage ordinance, might have been around 2021. That being said, I'd like to revisit where that is, what that is, and if we did not pass it, we're going to have to dig this up, but I think that there's been some work that's been done in this space. And I just wanted to ask you, though, specifically, are there other cities that are models that we can look to and maybe have conversations with across the state to kind of dive deeper into that issue?
Yeah, I believe actually Syracuse did this. I think Syracuse has done this in the past. It's been a few years, so I can look back and look, but they had income raise that was for city employees, et cetera, to go to a living wage standard as well. So I believe Syracuse is one. If I'm wrong about that, I'll double check and get back to you. I will.
Great, thank you. And thanks for your patience waiting this out with us. Thank you.
Yeah, you can read all the other data stuff later.
Thank you. Councilmember Martin.
Rosemary, you're just so incredible. I'm just the action, citizen action, and you take are just deeply principled and in line with your beliefs. Like, you do what you say, you show up in very powerful ways in service to our community. Just super grateful that you're here today. One of the things that or the populations a lot of the time we forget about in these conversations are people who have been incarcerated and their families, and how that significantly affects children and youth and all of that. I know one of the bills Citizen Action is working to fight for is the gate money bill. Can you talk to us about that and how it impacts our community?
You know, the one thing that, this is really personal to me. What many of you don't know is not only was New York State was my mother and father, but I went through the criminal justice system. I wound up doing about 8 years in prison myself before becoming the executive director of this organization, which kind of put me in different spaces and at different tables to understand what was happening behind the scenes, either in government or as policy was being created. But as a child, I actually was in Spofford. If anybody ever heard of Spofford Juvenile Detention Center, was actually kiddie jails. But my first time in prison, I got home and they gave me $40 and a ride home to wherever it is that you were going, that you were paroled to. Many years later, today, they still give you $40 and a ticket home. $40 today does nothing compared to what it did before. And I have looked at like California and other states who have constantly increased that. Most of the people that are actually in prison are there because of, at the root of it, is an economic drive. Like, I don't have this for my kids, I'm going to go steal it because I need my kids to have this. Most crimes today have an economic undertone to them. And so we think that people coming out of prison, you all probably know Jaleel Montakim. It is my great pride and honor to have been able to hire him. He is over a 70-something-year-old man. I'm sorry, look at Social Security. Social Security aggregates the amount that you have and takes 35 years. He spent 50 years in prison. You're going to talk about somebody else that would have been very dependent on our systems. Instead, I am really proud of the work that he is doing, no matter what people may think of him, period and point blank. But coming home and giving people, putting money, a little bit more money in people's pocket, doing the milk bill, doing these smaller programs. Honestly, Citizen Action has always gone for like these big ticket items, right? Like, oh my God, we want $7 billion for public education, X billions of dollars. These are the numbers and the campaigns we've led. However, we are recognizing just how important these smaller pilot programs are and helping to shift the worldview and narrative, because so many people think at this stage that if I give money to somebody who's coming out of prison, or if I give money, additional money to a pregnant mother, what are they going to do with it? Oh, they're going to go spend it on drugs. They're going to spend it on alcohol. They're going to spend it on ways that that is not true. There has been study after study, which you'll see in the report, that shows that these folks will put that money towards their necessities, things like housing, childcare, the things that really matter to families. And mind you, there's one more concern, which is health care, that no one has really talked about in this whole session that I sat through. And I'm very concerned about the impact of health care. We've got to be very watchful and vigilant, particularly because DISH funding that is coming from the federal government, et cetera, will probably be eliminated through a regulatory law, which means that many people, the state of New York is not going to be able, they're going to be stretched so tight in terms of health care costs that it is going to trickle down to us, and we've got to figure out how to deal with those things.
Thank you. Councilmember Monroe.
Thank you for being here today, and definitely it's that mix of the macro pieces and all those things that fall together, as well as, and I mean, you know this, as well as those micro pieces, and to put together that complete picture. I don't have questions for you right now, but I'm looking forward to reading this, and I love both micro and macro, so your information was very helpful. And then, Council President, I actually got to help write the living wage ordinance when Brian Curran, a former council member, sponsored that. So I am more than happy to walk you through real quickly what it is.
Thank you for that. And I believe we updated it, but let's have a full discussion on that. I think it's important that we do revisit that.
So thank you to Citizen Action of New York and Ms. Rivera for being here today. Thank you so much.
Love to see you all. Thank you so much for your time.
That concludes our expert testimony this evening. Thank you again for coming out and sharing your testimony on childhood poverty and proposing a way to solve it in our city. Thank you to my colleagues for joining me this evening. Thank you to my city council member staff for your support and coordinating this hearing. Without you guys, this would not be possible. Thank you again for staying late. The feedback you have shared tonight will be a part of the report that the committee will produce. This report will provide a summary of your testimonies from today, along with an analysis of our childhood poverty survey responses. Together, the feedback from the forum we hosted with the city youth and tonight's feedback, my hope is that will take us through where we'll have the input and insights that you shared to identify recommendations to the entire city council on solutions that we can embrace, and not only here locally, but also at the county, state, and federal levels. So, just a reminder, we're doing this together. The committee, this is the first of 2 days of expert testimony on the topic of childhood poverty. Our second hearing day will be on Tuesday, December 10th from 4 to 6 p.m. right here at City Council Chambers. All of these hearings will be streamed online on WXXI and City 12 and available for you to view later on YouTube. Good night, God bless, and be safe.